Recording. Record. ايش اسمه هنا؟ السلام عليكم ورحمة الله وبركاته. صوتي مسموع؟ الو، صوتي مسموع ولا لا؟ ماني سامعة شيء. السلام عليكم.
وعليكم السلام ورحمة الله.
سامعينني؟ فين المحاضرات؟ خليني افتح لهم اول شيء البروجرام. كريتيكال. محاضراتك ارسلي لي هي واتس. صباح الخير جميعا، الكل موجود؟ الرجاء من الجميع بس كتابة اسمه، الدخول بالاسم الثلاثي لو سمحتوا. مجمع الملك عبد الله، متدربين مجمع الملك عبد الله معايا؟ متدربين مستشفى الملك فهد موجودين؟ متدربين مستشفى الملك فهد للقوات المسلحة موجودين؟ طيب ممكن تكتبوا لي في الشات بس أسماءكم اللي حاضرين لو سمحتوا. طيب الصوت منخفض، علي الصوت يعني. صوتي واضح ولا مو واضح؟
أيوة دحين واضح.
دحين واضح. طيب
تمام.
طيب تمام، الله يعطيكم العافية. طيب بسم الله الرحمن الرحيم، نبدأ يومنا. اليوم بإذن الله حيكون الموديول عن الكرايسيس مانجمنت. We're gonna take and discuss these topics: introduction to crisis management, and then we'll talk about the framework for crisis management, and then we're gonna talk about sensory deprivation and ICU psychosis. Then after that, we'll take a coffee break for 15 minutes. Then we'll go to discuss transcultural issues in death and dying, grief loss counseling, and finally we'll close with acuity index in nursing model. First, I would like to introduce myself. My name is Nisreen Al-Andijani, the Nursing Director of Critical Care Diploma in King Abdullah Medical Complex, Jeddah. Welcome everybody, and now we will start with the first lecture, Introduction Crisis Management. Just give me a minute to open and share the presentation with you. كم العدد من مستشفى الملك فهد؟ كم عددكم مستشفى الملك فهد العام؟ عادي ممكن تتكلموا
عددنا
يعني.
5.
عددكم
عددنا
5؟
5.
مين؟ ممكن تقولوا لي بس أسماءكم؟
سارة القحطاني، وريم
أيوة.
محمد، وسام محمد، وعايشة حكمي.
طيب كلكم موجودين؟
أي موجود.
سارة وعايشة وسام وريم.
أيوة
مين باقي؟
بس هذا.
طيب أوكي تمام تمام. الملك فهد القوات المسلحة كم عددكم؟ عددكم 3. ممكن تقولوا لي بس أسماءكم؟ عفاف مبارك. مين الأسماء التانيين؟ نوف الحدادي ونوف علي. طيب أهلا وسهلا بكم، تشرفنا فيكم. طيب واضحة البرزنتيشن طالع ولا لا؟ مو طالع؟ طيب دحين طيب عادي ترى تفتحوا المايك تتكلموا معانا، يعني هو حيكون انتراكتيف سيشن. حنسأل أسئلة وانتوا تجاوبونا، وممكن انتوا تسألونا كمان واحنا نجاوبكم، ما عندكم مشاكل. تمام؟
تمام.
حلو. طيب بس نعمل ريزيوم شير. طيب كده أتوقع طلعت الشاشة صح؟
أيوة دحين طلعت.
طيب تمام تمام. طيب نبدأ الآن مع الأستاذة نجوى الحربي.
Good morning, everyone. All of you can hear me? Good morning, guys.
Good morning.
Today, our morning is really different. Very nice weather today. Best morning in this year. I hope our weather will be all like this to not have any crisis. طيب, our subject today, inshallah, we're going to talk about the crisis. And we'll know what the meaning of the crisis and how we can manage the crisis and the type of crisis. And I want all of you to share with me in the lecture, because all of us, we know what the meaning of the crisis. Who can tell me what the meaning of the crisis? What they mean if I'm telling crisis, disaster, what we are meaning? Who can tell me? There is Amal. Amal? The crisis is a major unpredictable event, or it can be the activity has potentially negative result. The crisis is the three common elements for the most of the crisis. One, it's a threat for the organization, and the second one, it's the element of surprise and the short of decision time and the need of change. This is the three common elements. The type of crisis, we have many types of crisis. The first one is financial crisis. The second one, technological crisis, and crisis of malevolence, and natural crisis, and crisis of deception and workplace violence. Now we can talk first about the financial crisis. This crisis occur in the organization due to its preference and financial condition. The financial crisis actually, it can be losses of the losses increase in the cost, for example, and non-availability of funds. And like what happened during the COVID-19, most of the country, they have economical crisis, especially the China and the America also. And there is example for financial crisis, like manufacturer airline recently faced the financial also crisis, and the Deutsche Bank faced also financial crisis. So the financial crisis can be happen unpredictably. The technological crisis, this is the second one. The technological crisis can cause by human application of the sense and technology. This occurs when the technology become complex and the system break down. Like, for example, the software failure. The software failure in the British Airways has struck by another IT clutch in the August 19. So they have technological crisis in the British airline. Also, we can say the industrial accident. It can be falling object and chemical burn in the industry. It can cause the technological crisis. The natural crisis. Who can remember the Jeddah floods in 2019? We have natural crisis, the floods, and we have a lot of people, they died at that floods in 2009. So the natural crisis can be natural disaster, consider act of God, and are just also can be environmental phenomena. The earthquakes also like Japan, volcano also eruption, and tornadoes and hurricanes. And there is also landslides and tsunami and storm. So this all, we can say this is the natural crisis. So the good example for that, tsunami, all of us, we know that tsunami, it's happened in India, Sri Lanka, and also Indonesia. So the important things now, we want to talk about the management of the crisis. How we can manage this uneven crisis happen. طيب, it's the process by which the organization deal with the major unpredictable event that threatens and harm the organization, its stakeholder and or the general public. A crisis can be anticipated. The institutes should be audit their internal process for check the potential crisis. So we can prevent this crisis by preparation before, by training people, making our plan to prevent and this crisis. So crisis can be prevented once the potential crisis is detected. Like now we will have a rain, so they first after the Jeddah floods, we have a lot of people died. So since that happened in Jeddah, now we have we are doing the plans to prevent this crisis to happen again to all to Jeddah. So what they did, also the school, all school, it will be closed at this time. We will have announcement early about the rain, so we will prevent the crisis to happen again to us. Type can be prevented once potential crisis is detected by institutes, can be also take proper measure. Correcting at the early stage will prevent the major ones from developing. Crisis can be controlled also, even prevention not possible. The institute can be manage the crisis one step at the time till completion. And also we can turn the crisis as advantage if institutes take the right step at the end of result by the positive. We can make it positive. A crisis will run to the course in the left untreated. To the best practice for managing the crisis, first, planning in details for response for many potential crises possible, establish monitoring system and practice to detect early signal by foreseeable crisis. And also establish and training a crisis management team for selecting and external crisis management firm with proven track record and in the business area. So they will train the people, they will make the plan, they will try to prevent the crisis by arranging very good plan. طيب, involving many stakeholders as a possible all planning and action stage. We can also make the crisis as a phases. We can say pre-crisis phase and crisis response and post-crisis phase. So in the pre-crisis phase, we'll start the prevention and preparation. How will prevent? We'll involve the seeking to reduce known risk. So we know now Jeddah happened floods at this day. So we'll prevent from the beginning. If the rain came, so we'll not allow anyone to go out. So they will have warning message in our mobile. So this part of an organization risk management program. So they will start the prevention from before the crisis will gonna happen. The preparation involves the creating the crisis management. We'll plan selecting and training people for the managing the crisis, conducting exercise to test the crisis. So as also in the hospital, sometimes we are doing the disaster drills. So all this one as preparation and prevention, the pre-crisis phase. The crisis response. The crisis response which management does and say after the crisis hits. The public relation plays a critical role in the crisis response by helping to develop the message are sent to the public. A great deal of the research has examined the crisis response. That research has been divided in two sections. There is any question here? Until now, then any question, guys?
No, thank you. It's so clear.
It's clear?
Yes, clear.
Yes.
طيب, the initial crisis response, repetition, also repair and behavioral intention. So it's two sections very important. The post-crisis phase. In the post-crisis phase, the organization is returning to business as usual. The crisis is no longer. So all of us, we should know the crisis is no longer, but how we will prevent and how we will deal from the beginning. The focal point, management and attention, but still required some attention. So here we have an example of the successful crisis management. The best drink. Who like the Pepsi? Actually, for me, it's the best. طيب, the Pepsi company faced crisis in 1993, which was successfully managed by this company. Actually, with the problem, in 1993, clam syringe being they found in the Pepsi diet. So what they did, the company urged store company urged store not to remove the product from the shelf while had the cans at the situation investigated. So Pepsi released what they did. How do they solve this crisis? They released many videos and they made public showing the protection process to demonstrate the tampering of the was impossible within their factory. So they show the people how they are making the Pepsi can from the beginning. The crisis actually with it's managed with effective communication. Until now, we are drinking Pepsi. Also, as a good example, a near example, actually, it's COVID-19. How our country it's managed this crisis. Actually, this crisis, a lot of country they will have financial crisis. They will have a lot of people die. They cannot control. But actually, our country it's the best managing of crisis. They stop all the people to coming to our kingdom. They close the Hajj and Umrah. They try to I cannot see their message. Actually, the COVID-19 management by our country, it's the best example we can say in this year, because it's not only natural, it's not only virus, also there is financial crisis at this day for many countries. But alhamdulillah, our country it it's managed very well. طيب, anyone can tell me the example? The earthquakes in the Japan, they make the first طبعا a lot of people die because of this the crisis. Now when they are building their houses, they are building by sway special building. So if the quick earth started, the building it will sway with the movement of the earth. So it's really also it's good management in Japan. We should not denying the fact in crisis, taking also precautions, steps to ensure quality and regain the confidence, gaining back also struct and benefit to the good campaign. My lecture is about to finish. Any question, guys? Any question?
No, thank you.
No, thank you. It's okay.
I hope all of you enjoying this nice weather. So please be careful because there is message. It's come to me yesterday. What is that message? From the Center of Crisis, مركز الأبحاث والكوارث بإمارة منطقة مكة المكرمة. يهيب بالجميع أخذ الحيطة والحذر وتجنب مجاري السيول ومناطق تجمعات المياه نظرا لتعرض محافظة جدة والمحافظات المجاورة لحالة مطرية. يعني إن شاء الله حيكون حالة مطرية يوم السبت والأحد حسب تقارير المصادر مركز الأزمات والكوارث. So please take care all of you. So always we are in the first line in any crisis. Thank you, guys.
Thank you so much.
Any question?
No, thank you.
We'll have another lecture. There is a lecture framework of crisis. Just give us 5 minutes.
طيب السلام عليكم ورحمة الله. My name is Nisreen Andijani and now I will talk about framework of crisis management. طيب مع أستاذة نجوى اتكلمنا عن عموما definition of crisis in general. crisis اللي هو اللي كانت اتكلمت عن financial crisis, natural crisis, right?
Yes, right.
طيب الآن حنتكلم عن بعد تاني عن الكرايسيس، يعني الكرايسيس in critical care setting. طيب by the end of this lecture إن شاء الله you will learn the definition and theoretical framework of crisis intervention counseling. You will gonna identify and use crisis intervention techniques in work with the client who are in crisis. Also we'll learn how to document crisis intervention work in the clinical record, and will realize the importance of safeguarding your own well-being while working with client in crisis, especially in ICU, and explain the challenges and innovation in medical setting. طيب. First of all, we have definition, we have a crisis technique, we have also the family and grief counseling, family present during procedures and resuscitation, and the trans-cultural issues. You will take it with Mr. Anish, inshallah. Okay, the definition of theoretical framework. What is crisis? What is the meaning of crisis from your own perspective? مين يقدر يقول لي إيش الكرايسيس؟
Surprising event that will lead to some potential risk or negative result.
Exactly. So it is an event that is perceived as overwhelming. يعني بمعنى أصح from يعني from another perspective, this is a situation that can change negatively the person lifestyle. So a situation becomes a crisis when the client believes that they have exhausted their resources and coping abilities. طيب, what is the perceived as a crisis by one person may not be perceived as a crisis by someone else. كيف يعني؟
Miss, the slides not shown here.
Really?
Yes.
الباقيين عندكم واضحة السلايد ولا لا؟
لا
واضحة.
شير. طيب الآن؟
Still.
باقي.
Still؟
ايوه.
طيب دقائق بس. طيب الآن؟ ما في؟ غريبة، دقيقة بس. طيب خليني أقفل اللي قبل. طيب السلايد حقت أستاذة نجوى طالعة ولا لا؟
أيوة كانت طالعة أول.
طيب دقائق بس. أنا ماني عارفة ليه هو بيطلع لي إنه بوست. طيب نعمل نيو شير تاني. طيب ناو
طلعت.
طلعت تمام. أوكي بسم الله. طيب كده واضح خلاص؟
ايوه واضح.
طيب تمام. طيب الآن اتكلمنا عن الديفينيشن أو لسه ما أيوة اتكلمنا عن الديفينيشن of crisis in theoretical framework. طيب what is perceived as a crisis by one person may not be perceived as a crisis by someone else. What the meaning of this؟ يعني أنا ممكن في situation يكون بالنسبة لي crisis لكن situation هذا بالنسبة لشخص آخر is not right. طيب specifically يعني احنا حجينا نتكلم specially in ICU. في ال ICU بالنسبة للبيشنت بالنسبة لل patient and family is it crisis؟ crisis right؟
Yes.
Right.
This is yes it is crisis for them. So now this is the definition. Now we'll يعني in this presentation we'll talk about crisis in the personal perspective of patient and family in ICU. طيب human being typically fear of change. That's right. طيب fear of change that's mean the homeostasis will be imbalanced. إيش هو الهوميوستاسيس؟ عندكم فكرة إيش هو الهوميوستاسيس؟ What is the homeostasis؟ اديني definition آخر للهوميوستاسيس. يا ريت تشاركوا معانا كلكم مش بس سناء وعفاف. What is homeostasis؟ قد سمعتوا عنها الكلمة هذه؟
balance.
balance
Stability.
stability equilibrium right. So it has many definitions the homeostasis. في external homeostasis and there is internal homeostasis. لما البيشنت بيدخل للاي سي يو ايش بيصير عنده؟ ليه هو دخل الاي سي يو ايش صار عنده؟
internal
homeostasis instability right. صار عنده respiratory abnormality، صار عنده renal failure، صار عنده kidney failure sorry liver failure. So many homeostasis instability صارت internally. طيب externally لو جينا تكلمنا على homeostasis externally ممكن ايش تكون بالنسبة للpatient and family؟ حتكون ايش؟ physically financially emotionally socially. So all of this will be imbalanced. حيكون في imbalanced in all of this. So all of these changes can cause crisis for the patient. طيب client may become radically distressed when they sense the threat to their own homeostasis. This is يعني سبحان الله الله أعطانا حدود لصبرنا وحدود لمعرفتنا، بس خلال الكرايسيس إيش بيصير؟ إيش بيحس الإنسان؟ بيحس بالسترس right؟ طيب هنا يجي دور إيه؟ يجينا دور the role of counselor right؟ The role of counselor here to prevent entropy. الانتروبي اللي هي الانتروبي that the client cannot be able to do his job and he has no energy to do anything. هنا يجي دور الكونسلر عشان يساعد البيشنت والفاميلي يرجعوا البالانس to their homeostasis. طيب also injecting self to aid client is stabilization. يعني مين اللي بيكون كونسلر هنا؟ مين اللي يكون الكونسلر في هذه الحالة؟ لما في عندنا اللي هو في الكريتيكال كير الميديكال فيلد included whom؟
the nurse the doctor.
الدكتور. مين كمان؟ مين عندنا في الميديكال فيلد برضو يساعدوا في الكونسلر وإحنا عادة نناديهم طبعا نعمل لهم social worker ممتازين. والسوشيال worker لهم دور فعال جدا في الكونسلينج. اوكي طيب طبعا في شوية معلومات ممكن تستفيدوا منها. For example, people in crisis usually register less than 15% of information they receive during crisis. Why?
because they are under stress cannot be very
أيوه.
clear to get.
Exactly. So a patient and their family become anxious physically, mentally, become anxious. Even the information that you are giving to the patient and family, it becomes إيش؟
Less effective.
This ممكن تكون effective ممكن تكون ineffective. It depends on the information that you are giving to the
Yes.
patient. صح؟ So always you have to avoid نقدر نقول to avoid what? To avoid medical terminology.
Yeah. Simple
أيوه.
word,
Simple
simple
word.
way.
So discuss with them in simple word, in simple
Yes.
way, and always prepare yourself while you are talking to the patient. يعني before you are go to talk to the family, before you are going to talk to the patient.
Yes.
So you
Yes.
have to prepare your knowledge.
Mm.
and you have to prepare yourself physically. يعني حتى ال body language ممكن تعبر عنك. فهذه
Yes.
كلها تأثر في ال understanding. طيب. Of course, social worker can help by remembering the difference between crisis and the emergency. طيب. طبعا في أشياء معلومات يعني ما تحتاجوها. طيب taking care of yourself. هنا يجي دورك أنت كممرضة في الآي سي يو. أنت بتستقبلي تقريبا شحنات سالبة طول الوقت right؟
Yes, right. Totally right.
Totally right. مين يقول لي طيب دحين هل بنتأثر إحنا as a nurse بالبيشنت بالفاميليز؟
Yes, we observe their problems and sometimes we reflect that in ourselves without knowing.
أيوة. So إحنا نقدر نقول إنه النيجاتيف إنرجي أو ممكن حتى الكرايسيس اللي بتصير حواليننا للبيشنت بتتحول ل contagious. Right? It is contagious. دايما إن كان مشاعر الفرح أو مشاعر الألم بتصير contagious. سبحان الله. إحنا في الآي سي يو كنيرس كميديكال ستاف أو نيرسينج ستاف معرضين دائما لل بيرن اوت. رايت. اتكلموا عن البيرن اوت في يوم الاحد اللي راح.
No.
طيب النيرس في هذه الحالة هي معرضة للبيرن اوت بشكل كبير. ليش؟ اولا بسبب السيتويشن اللي هي في قسم الاي سي يو عموما. رايت. ثانيا بسبب حالات البيشنت اللي بتدخل. ثالثا بسبب الفاميليز اللي هم طبعا they are very stressed, they are really anxious وانتي بتتحطي في الموقف انه انتي you have to talk to them يعني as a nurse you have to talk to them, you have to ensure them, so you have to take this يعني to consider this into account your health, your mental health and your physical health. نحاول دائما you have always to put yourself out. يعني إحنا لما نكون بنواجه هذه الأشياء بنحاول إننا نعمل exercise لنفسنا بحيث إنه نعمل لنفسنا barrier between this negative emotions أو negative between this crisis and between us. عشان إيه؟ عشان ما يصير عندنا burn out. طيب طبعا بنتعرض للإكستريم أنجر للبيشنت. البيشنت بيجوا في مرحلة الجريفينج. صح؟
Yes.
بالذات إنه their loved one in ICU. so حنتعرض لإنه الفاميليز becomes denial becomes anger. حتعدي عليهم بكل مراحل السيتويشن اللي هي إيش يقولوا عنها الجريفينج right اللي هو
Yes.
الجريفينج stage. So you have to put a mask for this. إنه أنت ما تتأثري بالنيجاتيف سيتويشن اللي أنت بتتعرضي لها عشان ما يصير عندك بيرن أوت. طيب how to do this technique. always use slow and deep breathing. دائما الديب breathing effective. حتى لو إحنا ما نعرف نعمل مثلا meditation ما نقدر مثلا نعمل manage to our emotions. always يعني simplest thing that you can do it slow and deep breathing to keep yourself calm when you are working with the client, especially مع اللي هو critically ill patient and their families. طيب, and you have also to understand that client anxiety and or anger may be contagious, as we said before, and be prepared to avoid being infected with their emotions. And you have to know that you are not required to feel the crisis for your client. يعني انت ما انت مطالبة انك تحسي بنفس المشاعر اللي هم بيحسوها. ايوه, انك تكوني sympathetic empathy. ايوه, الامباثي حلوة, انه انا احس ب مو ما نقول ان نحس مشاعر عميقة, لا, بس we have to show ايوه empathy للبيشنت والكلاينت. لكن اننا نحس بدي المشاعر, no, you don't have to feel the crisis with the family and their patients. طيب, and during your off also you have to rest very well. طيب, هذه شوية technique that help you to avoid or to put barrier between you and this contagious emotions. طيب, نجي عند الفاميلي and grief counseling. طيب, the news that the patient is dying will usually destroy any hope that the family may have for a recovery. طيب, having their deepest fear expressed as a certainty provide a trigger for a crisis point, and it is often only then that they will break down. طبعا احنا لما يكون البيشنت والفاميليز they are fear, they are anxious, we have to take a step to let them express their feeling, right? طبعا how we can let them express their feeling. تفضلي, مين بيتكلم؟ سناء؟ ايوه, كنت بتقولي شيء؟
لا, مو أنا, ما أدري.
طيب, responses range from grief to denial and anger. طبعا during hospitality and critically ill situation في الاي سي يو, الريسبونسز حقت الفاميلي بتواجه الناس الدينايل. طبعا هو usually بيكون first denial, بعدين حيبدأوا يصيروا anger. طبعا مراحل إن هم accepting الجريفينج حتيجي بعدين, بس إحنا بنواجه عموما التو first stage اللي هم الدينايل والأنجر, right؟ في الاي سي يو بنواجه عادة البيشنت الفاميلي بيشنت الدينايل والأنجر. طيب
Yes.
طيب, some people use denial as a coping machine and will be unable to accept what is said to them. يعني انتوا حتى لما تحاولوا انكم تشرحوا لهم what have been done to the patient, what is the medical situation for the patient, and what is the procedures that is doing to the patient, sometimes they are denial. يعني بعض patients حتى consent, if there is any important procedure to do with the patient,
Yes.
they are refusing to sign it, right?
أيوة, like the DNR also.
أيوة, بالذات DNR. طيب طيب, في هذه الحالة أنت as a nurse what you have to do?
We should give them time to accept.
Give them time to accept, right?
Because
طيب.
they already need to copy with this one. It is hard one to.
أيوة.
If we are were in their situation, we will show this also.
طيب, أنت اللي عليكي حتسويه حتشرحي لهم, right? طبعا in a simple way. طيب, إذا أنت عجزتي إنك تفهمي الفاميلي عن البيشنت سيتويشن, عن البروسيجرز whatever, حتعملي إيش حتعملي لهم ريفيرال لمين؟
الدكتور
للدكتور أيوة, اللي هم الكونسلر أو السوشيال وركر. السوشيال وركر مهمين في هذه الناحية, في هذه يعني أنت بالذات لما يكون البيشنت DNR, مين المفترض إنه يتكلم مع البيشنت and the family regarding DNR?
الكونسلتنت.
Also the social worker.
DNR أساسا ما حيعملوها إلا لما يعملوا committee, right?
Yes, yes.
وعادة يكونوا البيشنت family included, right?
Yes, yes. Will be discussion.
They are discussing this one, right? طيب their responses may also seem inappropriate to the gravity of the situation, and staff may need to assist the individual to determine whether forcing them to face reality or retain their defense is appropriate. طبعا أحيانا بتلاحظوا إنه حتى الرياكشن حق البيشنت والفاميلي، مش البيشنت، الفاميلي بيكون إيش؟ بيكون ما هو نقدر نقول appropriate. It's not inappropriate. بتواجهوا دي الأشياء. مين ممكن تقول لي يعني قصة؟ نبغى نسمع قصص. يكون السيتويشن يعني inappropriate to this reaction بس we have to cope. يعني ممكن يجيكي patient من كتر ما هو خلاص يعني أو family من كتر ما هم خلاص مصدومين، ما هم حتى يعني
sometimes they laugh when we speak to them about something. They laugh.
Exactly, they laugh.
Yeah.
حتى إنك لما تيجي تشرحي لهم شيء ما بيستوعبوا أنت إيش بتقولي. Right?
Yeah.
So this is our job or our role to let them face the reality. طيب with an appropriate way of course. طيب طبعا anger may be also be expressed as a response to the situation and should be dealt with using understanding and tact. طيب قد واجهت patient أو family sorry دائما أقول patient family anger بالذات لما يكون البيشنت دي ان ار او patient dying وقتها. always صح. بنلاحظ حتى السيتويشن يكون حتى الرياكشن حق الفاميلي بالذات لما يكون في كذا شخص يكون inappropriate، يبدأوا يلوموا بعض صح. yeah blaming themselves blaming each other
and they think they are the reason.
ايوه this sometimes even يعني inappropriate يعني stories coming out يعني حيبدأوا حتى يفضحوا بعض.
ايوه ينشروا غسيل.
ينشروا غسيل بعض. ايوه فهذه السيتويشن you have to deal with it also. طيب انتي as a nurse قد واجهتي دي مشكلة زي كده وحاولتي تحليها؟ أو أنت as a nurse يعني خلينا نسمع الأولاد يا جماعة. وسيم ولا وسام؟ عبد الرحمن؟ بندر؟ في بندر معانا؟ ولا أمل؟ أتهيألي أمل. طيب أبغى أيوه طيب يا أمل قولي لي هل واجهتك كده situation واضطريتي إنك تتعاملي مع الفاميلي of the patient؟
مرة كذا صارت سيتويشن مع بيشنت، يعني أختي توفت وصار يصرخ فينا أنتوا السبب أنتوا مدري حاولنا نعمل معاه شيء كنترول وما قدرنا، فنادينا السكيورتي عشان نتعامل معاه وأفتر ذات السوشيال وورك.
صح. إذا لما تكون النيرس unable to manage the situation so she has to refer the situation to whom? The appropriate person, if whether it security or the consultant or even the social worker. طيب نيجي نتكلم عن الفاميلي سنترد كير. ليه اتعمل الفاميلي سنترد كير؟ why is family centered care created? is a concept of treating the patient and family as an separate entity, recognizing that illness or injury of one family member invariably affect all the other family members. طبعا الفاميلي سنترد كير صار له سنين هم يعني شغالين عليه، بحيث انه في سنة من السنين يعني in the past طبعا أظن في الثمانينات أو في السبعينات they involve the family in the family centered أو سماها family centered care. Why? Because the situation of the patient or the illness of the patient is affecting what? Affecting the family, affecting the patient emotionally, family emotionally, physically and spiritually as well. طيب a holistic approach to critical care nursing requires that the family be included in the plan of care. طيب هل احنا هنا في السعودية بنعمل including الفاميليز in the plan of care؟
not always.
طيب طبعا إحنا يعني يمكن معظم المشاكل اللي بتواجهنا عادة في الكرايسيس سيتويشن يكون ineffective communication.
Yes.
ineffective communication between اللي هم الهيلث كير وركر والفاميلي. رايت. طبعا هذه شغالين عليها حاليا بإيه مسمينها تجربة المريض، صح؟
Yes صح.
we have involved تجربة المريض في هذا المجال بحيث إننا نطور ونحسن الكوميونيكيشن between الهيلث كير وركر والبيشنت and the family. طيب خلينا نتكلم دحين عن once إنه البيشنت admitted to the critical care unit, what you have to do as a nurse. Patient admitted to ICU. As a nurse, is it essential what to do?
The initial assessment to the
initial
patient.
assessment. فعلا إيه. أول شيء إحنا بنعمله أو إحنا إلى الآن بنعمله initial assessment to the patient. طيب هل فكرتي يوم وانت بتعملي initial assessment to the patient اللي هو physically انك تاخدي برضو الهيستوري؟
Yes, sure. It's important part.
This is a very important part. Why?
Because maybe this problem he admit with related to old one.
Of course, exactly. So عشان انت حتحطي لنفسك baseline, right? We have to take the family history and the patient history to put a baseline for the assessment. ناخد the history of the family and the history of the patient and the history of the illness for the patient and whether طبعا الtrauma, how it happened or whatever, how it becomes, so we have a base for our assessment. طيب essential information is gathered during the admission assessment and additional information is obtained as available often during visitation. طيب we have to consider family needs. طيب many researchers have identified a predictable set of need of family members of critically ill patients. إيش هي هذه الثلاثة الأشياء؟ receiving assurance, being comfortable and having support as available. طبعا receiving assurance يكون بمين؟ who will give the assurance for the patient and the family؟ ايوه الهيلث كير وركر اللي هم included الفيزيشن، النيرس، السوشيال وركر، right؟ طيب هم هنا حيعملوا assurance for the family and then let them being comfortable. كيف يعني being comfortable؟ كيف نخلي البيشنت الفاميليز being comfortable؟
By follow up with them, asking them, giving them the assurance, giving them the right to express themselves.
Right. And give them all the information that they need to become more comfortable, to relieve anxious, right? And finally having support. Let them and give them the appropriate support. طيب meeting these needs increase family satisfaction also and may reduce the development of post-traumatic stress disorder in family member. طبعا هذا كل الكلام اللي احنا قاعدين نقوله فين موجود في الكتاب اللي أرسلته قبل فترة أظن اسمه الهوليستيك أبروتش. طيب حتلاقوه كده في صفحة 108 حاجة 118 بس حتلاقوه في تشابتر 1 2 and 3. تمام؟ طيب هذه كلها تجميعة يعني ما حتلاقوا الكلام كله كده مترصرص زي ما هو، فيجي دوركم إنكم تقرأوا. طيب lack of communication، طبعا تكلمنا على communication. lack of communication كيف ممكن يأثر على الكير حق البيشنت والفاميلي كير. طبعا nurses can facilitate better communication by providing simple, honest report of the patient's conditions free of medical jargon. إيش هي الميديكال jargons؟ What is the medical jargons؟ medical jargons
medical terms نفسها.
medical terminology you have to avoid it لأنه مو كل البيشنت اللي نحن نتكلم عنهم ممكن يكونوا في نفس الليفل of your education، يعني ما هم نيرس أو ما هم دكتورز. ف يعني حتى لو جوكي مثلا ناس high level of education they will not understand the medical terminology.
Yes.
طيب one strategy is to encourage family member to assist in patient assessment, identify changes. طيب how to identify changes؟ احنا بنقول هنا there is one strategy to encourage the family member to assist in patient assessment. يعني احنا ممكن once the patient admitted to the hospital we take the history for the patient and assessment from the family. صح؟ after some after يعني 2 days, after 3 days or in the same day we can discuss these changes with the family. We can discuss what is the physical changes happen to the family so they can assist also. They can identify that what happened to the patient and what changes happened to the patient, and also they can يعني they can give very important information for this.
Yes.
طيب depending on the institutional policy it may possible to enlist family member to help with tasks such as oral care, hygiene, range of motion, exercise or repositioning of the patient. Who's doing this
Yes.
in ICU؟ هل
The
لما
nurse.
بيصير ايوه النيرس بتعمله صح؟ طيب during the
Mm.
visiting time are you يعني let them give some care to the patient؟
It was
خلينا
supposed to do, but we are not doing.
we are not doing صح؟ طيب
Yeah.
why we are not doing right now؟
Maybe because this corona and prevent cross section
Yes
infection and like this.
to prevent cross of infection because of pandemic. طبعا كثير أشياء تغيرت خلال ديك الفترة but especially if the patient is in the hospital يعني ما نقدر نقول إنه and stabilize even if he is in on mechanical ventilator. But
Yeah.
during visiting time, especially if the family member they know how to do, يعني we can assist them while they are doing. We
Yeah,
can
yeah,
show
we
them
can.
that. أيوة. So this one can also lessen the fear.
Yeah, yeah.
حيحسوا إنهم involved more in care. حيحسوا إنهم إيش more
They
comfortable.
help. Yes, they
they
help.
help. أيوة.
Mm.
طيب. These activities give family members a sense of purpose. A sense of control. يعني كل ما حسيتي انك انت over control وتقدري تعملي سبحان الله الانسان بطبيعته يحب انه يكون هو السنتر اوف كير، بالذات لما
Yeah.
يكون عندي انا patient في المستشفى حابة اني ايش اساعد. عشان ايه؟ عشان سبحان الله الواحد احيانا ايش عشان يرضي ضميره، لما يرضي ضميره يكون ايش مرتاح صح.
Yes.
Yes, as well as potentially provide an additional layer of safety when the nurse is unavailable. طبعا يعني نادرا ما تصير إنه إحنا نخلي الفاميلي with the patient alone، نادرا بالذات في الآي سي يو. بس يعني ما أعرف برا هم كيف عاملين زيارات للفاميلي وفي الاي سي يو ممكن يخلوهم فتره كده مع البيشنت، بس هنا يعني في حذر اكبر، يعني بحذر اكبر ان نخلي الفاميلي مع البيشنت الون في الغرفه بدون ما يعني نخاف على البيشنت. يعني هذه يمكن يبغى لنا نشتغل عليها مراحل. right. طيب in conjunction with more liable visitation policies many institutions have implemented policy to allow families to be present during invasive procedure and cardiopulmonary resuscitation. طيب لو جينا نتكلم عن البوليسي، من أي في عندكم مستشفى تسمح للفاميلي إنهم to be present during CPR؟
لا.
I think no.
Any hospital they are allowing patient family to be in during CPR to be present, right? طيب
But how could this be?
how it could be طبعا إحنا يمكن still we have to prepare people here. يعني
Yes.
still the culture عندنا الculture level of awareness عند ال patients وال families is not that much
Yes.
عشان نقدر نقول. بس هل اتعملت دراسات؟ is there any research done for this؟
Actually, we don't know.
we don't know. طيب نقدر كذا ندور
Yes.
على research كذا
Yeah.
ممكن يعني تبحثوا عن هذه الأمور. حلوة لما تشوفوا ريسيرش، حلو لما تبحثوا يعني شوفوا المعلومات اللي احنا أخذناها اليوم عن الأنجر، عن الجريف، عن resuscitation أو presence of family during resuscitation. حتلاقوا many research talking about this. طيب ليه احنا الفاكتورز cited for limiting family member presence including limit during resuscitation أو نقدر نقول during any procedures؟ ليش احنا ما بنخلي الفاميلي members يعني from
Because
our
it's a sensitive
experience.
situation.
sensitive situation. ليه sensitive؟ طب حتى الفاميلي هذه بالنسبة لهم sensitive situation، يبغوا يكونوا حاضرين مع البيشنت.
If they are there, they want to do something, and that will involve and cost the time. And in this situation, the time is very important. We should manage it very well.
So from our perspective as a healthcare worker, it could be a barrier, or we can interrupt
Yeah.
our work, interrupt our job as during emergency situation, right?
Yes.
طبعا وقتها حتى ال health care member become stressed
Yeah.
the time, right?
Yeah.
طبعا انت stressful situation and there is also a family member there are under stress، سحتكوني under stress of many
Yes.
many
We will be squeezing.
yes you will be squeezing. So as a nurse طبعا احنا بنكون هنا يمكن عنصر محايد. يعني احنا بالنسبة لنا we don't let the family to be involved in CPR أول شيء because of lack of awareness of the family member, right? during for the procedure. هذا أولا. ثانيا stressful situation والpatient والfamily is anxious, right?
Yes.
طيب ثالثا طبعا حيكون stressful for the healthcare worker. ولكن نجي نقول تاني however these factors have not been substantiated by research. رجعوا تاني researchers قالوا لا, we have to consider and we have to involve the family and allow them to observe the invasive procedure and the resuscitation. Why? قالوا to prompt increase knowledge of the patient condition. Let them know about the patient condition. يكونوا witness. يعني sometimes الفاميلي ايش بيقولوا؟ انتوا قتلتوا المريض، انتوا قتلتوه، right? during resuscitation لانهم هم ما شافوا بعينهم ايش اللي حصل. ف it is becomes as a witnessing. طيب هذا بالنسبة للريسيرشرز. طبعا هذه latest researchers said that it prompt an increased knowledge of the patient condition and allows witnesses that everything was done and reduces fear and anxiety and promotes adaptation. إيش يعني promotes adaptation؟ يعني يخلي الفاميلي member more accepting لما يشوفوا البروسيجرز. طبعا هذا كلام إيش؟ كلام الريسيرش.
Yeah, we will read it.
إن شاء الله. benefits of family presence. طبعا نتكلم عن benefits being present help family member. طبعا إحنا ما نتكلم عن بس CPR، بس ممكن نتكلم عن other procedures that you can involve the family in. other procedures that you can involve the family in زي مثلا for example الفيزيوثيرابي.
Yeah.
صح؟ يعني شيء it's not life threatening. يعني procedures is not life threatening. For example like feeding.
الهيمولوجيز.
feeding, positioning. هذه الأشياء إحنا ممكن نخلي الفاميلي member to help us during this. So it will remove doubt about the patient condition. It will provide witness that everything possible was done. يعني everything يعني حيجي يقول لك طب انت ممكن في شيء نسيتيه، ممكن في شيء ما تعمل فيه، شيء ممكن انتم ما عملتوه. فهذه خلي البوسيبيليتي انه هو البيشنت او الفاميلي family member they see what all the available resources that the healthcare worker done with the patient. طيب decrease their anxiety and fear about what was happening to their loved one and need to be together with their loved one, need to help and support their loved one and sense of closure and grieving should death occur. هذا especially لما يكون البيشنت ايش DNR. طيب طيب خلينا خلاص نقفل على الموضوع السي بي ار. Two recommendations are specified in the document. Provide family member of all patients undergoing CPR and invasive procedures. طبعا هذا برضو كلام الريسيرش، بس احنا طبعا عندنا في البوليسي والبروسيجر لا ما بيعملوا involve للفاميلي member. طيب طبعا what is the research recommendation for this? To develop a written policy for presenting the option of family presence during CPR and bedside invasive procedure. طيب الترانس كلتشرال طبعا حيعطيكم هي الأستاذ أنيش دحين حاليا إيش عندنا. طيب do you have any question regarding this lecture?
No, it's
No,
clear.
thank
Thank you
you.
so much.
It's clear.
الله يعطيكم العافية. حاليا أظن عندكم حسب الجدول إيش عندكم؟
Still we have another.
You have another lecture صح؟ إيش هي؟ خلينا نفتح لكم نفتح لكم طيب طيب حرجع لكم كده شوية مع مين النكست؟
أستاذ أنيش.
شوفوا لي
أستاذ أنيش.
أستاذ أنيش حيكون. طيب sensory deprivation and
Sensory
ICU psychosis
deprivation.
صح؟ طيب
أيوه
خلاص كده حأكلمه شوية وحيدخل لكم كده خلال دقيقتين. تمام؟
طبعا يعطيك العافية.
شكرا. We enjoy with you.
Sir Anish?
الو Hello, you can hear me?
Yes, we can.
Oh, thank you, Sana.
Welcome.
Okay, good morning all. Uh, anybody has any problem with the audition? I mean, you can hear me properly?
Yes, we
Yeah.
can hear you.
Okay, let's start. Assalamu alaikum warahmatullahi wabarakatuh. My name is Anish Mohammed. I'm working as nursing educator for ICU. I think we have 14 participants, 4 from King Abdullah Medical Complex and the remaining from other hospital. So today's discussion will be about ICU psychosis and sensory deprivation together, and as well as we will have proceed later to another portion where we will discuss about care of dying and dead patient, especially in the critical care unit. So you have any idea about ICU psychosis? If you have any patient who has come across with ICU psychosis, just share your experience for maybe 30 seconds. Anyone?
Mm.
What I know, Sana is only discussing. What about others? We have 14 participants. Anyone? Are you guys with me?
Yes, yes, we are with you.
Yes. You have you seen any patients with this is Afaf?
Yes.
Yeah, yes, Afaf. Do you have any experience with the patient who has developed with ICU psychosis before, or what is your idea about ICU psychosis?
I'm not sure that I'm facing any patient with psychosis before.
I did not hear you properly.
I don't have any patient. I didn't face any patient with ICU psychosis
With
before.
ICU psychosis. Okay.
Yeah.
Basically, ICU psychosis, this is an introduction slide where we are discussing a patient in the intensive care unit, especially in the critical care unit, has become delirious. Okay. Because ICU
Yeah.
is not a planned admission. It is always an acute, like an acute disease. It is an unplanned situation where the patient will be forced to go to a critical care unit. What's happening there? Patient will be either chemically sedated with the help of medications, and he will be on muscular relaxant. So by the time when he become last time conscious, he become disease because of the disease condition, and later he become paralyzed. So when he wake up, when he regain the consciousness, he will not know that, or she will not know that very exactly. So IC psychosis and delirium is usually two words usually will like interchangeably used. Okay. IC psychosis, as the definition says, it may last for 24 hours, even up to 2 weeks. The literature says that it can stay up to 14.2 days. Okay, this is a maximum duration. If still it is persisting, this is something which need to be rolled out for other cause, like maybe the patient is having severe delirium. We need to rule out that one and do the treatment properly. The definition says that IC psychosis is a disorder in which patient in an intensive care or a similar department, can be ICU, CCU, or any other critical care unit. Okay. Another terms may be interchangeably used ICU psychosis, but it is not the same. It is different. Okay. Because usually this is seen the patient who was on sedated for a long time. Okay. Patient who has trauma in the brain. Those are the patients who are highly victim. They have high risk of developing this brain ICU psychosis. So simple example, suppose if you are admitted in a room, okay, one isolated room where you don't have an opportunity to see what is happening outside the department, there you will have always a problem. Okay, so you will be confused where I'm exactly, what happened to me, these kind of things, it will be precipitating, and later the patient will be confused. So he will be able to recall something which happened before the onset of the current illness. Let's say, for example, a patient is admitted in ICU with head injury. So what will happen? The patient will be remembering, he will be able to recall everything before the incident of the accident. Okay. So when he wake up, when he's out of ventilator, when he's out of sedation, he will be able to recall what's happened before the accident, but he will not remember anything during the accident as well as when he was in an ICU. So this is simply the definition of ICU. So if the patient has persistent problem, that's the term we will use, ICU psychosis. Okay. Then how common in ICU psychosis? Literature says that there is 3 out of 5 patients admitted in an ICU unit or critical care unit. He might be at risk of having this ICU psychosis. May I know whose speaker is on? Someone's speaker is on. Can you mute it on? Mute on. Okay, let's go with the definition. There are certain causes which can precipitate, which can
This is a speaker, Miss Nisreen.
Yeah. No, I'm here only. I'm speaking from Nisreen's office only. I don't know whose speaker else is working. Someone else is using? All of your mics are mute, right? Let's see what is sensory deprivation. Here we have a definition. Okay. What do you mean by sensation? Anyone? What do you mean by sensation? We have Noof, Sarah, Ragat, Sana, Abdul Rahman, Afaf. Yes, Sana.
It's the feeling or sensation that's mean.
What is sensation according to you? I'm not asking you the book definition. What is sensation?
Something I feel.
The feel.
The feeling. Okay.
Yes.
As for human being, we have 3 types of sensation. It can be pain and temperature sensation, can be vibration or touch sensation. We say tactile sensation, and the advanced level sensation. These are the 3 ways which we can sense. What will happen to an ICU patient or a patient who's admitted in critical care unit? They will be deprived of this sensation. Okay. Either because of the traumatic injury to the brain or the sensation part, or maybe because of the chemicals or the medications which you are using, patient will be deprived. That means there is a lack of sensation from almost all the senses. So what will happen? Patient will not be able to respond to stimuli. Okay, this is sensory deprivation. We'll come to that part later. Okay, but this is one of the reason for ICU psychosis. This is one environmental. Imagine yourself in ICU, admitted in ICU, restrained both upper extremity and lower extremity, and with the help of medication, and all of a sudden what you are hearing is only some sound from the mechanical ventilator, some monitors, and people, nurses who are speaking some different language. And especially in Saudi, we have more expat nurses like Indian nurses, Filipinos, or maybe other language speaking. Okay, so the patient who's hearing only alien language, which they are not at all familiar, and some sounds. So what will happen? The patient is not at all oriented. Even if he has a stimuli, he will not be able to show. So at one point, he will lose all the sensations. This might be one of the reason it will cause confusion to the patient, and later the patient will become ICU psychosis. Sleep disturbance and deprivation. Okay, imagine all of you have ICU experience, right? So imagine, are we taking a morning bath anytime in early morning, 3 o'clock? Anyone? You're bathing, brushing, everything at early morning, 3 o'clock? No, nobody. Imagine our ICU patient. What time we are giving morning care? Usually it will start at 4 o'clock, right? The maximum. Okay. So this patient is already, they have sleep disturbance because of the pain, because of the trauma, because of the disease. Along with that one, we are giving them early morning care, which can disturb their sleep. So what we can do, unfortunately, No hospital will provide in the kingdom, as well as in most of the standard hospital, it will not give you a time during morning duty to give morning care for the patient. It's supposed to be finished by the night duty step. So what we can do, you should make sure that the patient is getting enough sleep at least during daytime. Okay, so
Yeah.
persistent sleep disturbance or deprivation, which can leads to problems and confusion to the patient. Imagine ourselves after the end of 3 night duty, what will be our situation? We'll be crazy, right?
Yeah.
So
Yeah,
this
sure.
can happen to our patient as well. So we need to be careful. So this can avoid. If you know the reason, we can avoid continuous light level. What is happening with the distribution? Continuous distribution of the normal or too much light on the patient. Imagine patient is lying in ICU, and all of a sudden on your face you have light which is continuously falling. So this can lead to one condition which is opposite to sensory deprivation or ICU psychosis. This is known as sensory overload. So this overstimulation, it will leads to confusion to the patient. Patient will
Yeah.
think that he died already. Maybe he is in heaven. Okay, things like that.
Or the hell, maybe.
Yeah,
We are
can
not
be,
experts.
can be as well. So what this can happen to the, so try to avoid this minimum. So what nurses, as a critical care nurse, what we can do when you are doing a procedure, just turn on the light on exactly on the top of the bed and do the procedure and do some manipulation. And I have seen in some hospital they have some nice scenery in the top of the patient. I don't know, in our ICU in King Abdullah, we don't have anything on the top of the bed. Okay, I think in other hospital. What about in KMC Makkasana?
Yeah, we have the educate life and
We,
beautiful faces.
painting, right? I think there is a
Yeah.
painting on the top of the. What
Yeah,
about
yeah.
the people from other hospital? I don't get any feedback from any other participants.
Our
There
light
is.
there, it's very
Huh?
good, very educated for every patient.
Sorry.
Our light there, it's very good and very educated for every patient.
No. I mean, the lighting. I know it will be perfect. I mean, do you have any specific like sceneries, any pictures which is on the top of the bed?
Yeah, we have.
Very good. This is from which hospital?
King Fahd.
King Fahd General Hospital.
No, Kafafa.
Military hospital, right? Hello. Okay. Then we will have stress. Patients in ICU frequently feel almost total loss of their loss. They feel that they are about to die. Those can leads to more confusion. Okay, maybe especially imagine the one who's admitted in the critical care unit. He is the earning member, and he has already developed and met with a serious illness, either an end-stage disease or maybe a serious disease. So this will add on the stress to the patient, and it will make them more confused. Okay, lack of orientation. This part we nurses has greater importance. Why? When you go to the patient room, try to talk to the patient in simple words about the date. Today is Tuesday, Monday, something like that. You just reorient, keep on reorienting like that. You noticed like toddlers, when the preschool kids, when they are going with their parents, they will be asking 100 questions. They will be asking, where are we, what we supposed to do, what is this, why like that. So this is a situation of a patient who's admitted in critical care unit. So what we have to do, reorient them, continuously
Yeah.
reorient. You have to tell them what time is right. You don't need to tell that now it's 9 past 45 minutes exactly. No, tell them according to their level. If he's an young patient, you can tell them this is morning, afternoon, like that. If it is an older patient, we can say this is a time for lohar, the prayer time. This is a time for asr, so that they will know this is day or night. Because once you are in ICU or in a critical care, especially in a closed unit, you don't know whether it is day, night, whether it is raining, whether it's a bomb blast outside or whatever it is. So you have to reorient them. So it will make them less confused, and it will prevent the ICU psychosis. I hope it is clear, right?
Yes.
Okay,
Yes, clear.
medical monitoring of the patient. Continuously monitor the patient's conditions, especially vital signs, noise, which be disturbing for the patient continuously. It may be familiar. For example, a person who's working in ICU for 10 years, maybe she or he cannot sleep without hearing this ventilator alarm, because it is, for us, it is used to. Imagine the patient, this is first time in his life, he's experienced this one. So if it is continuously alarming, maybe that is a unfamiliar sound for the patient, it will be really disturbing for the patient. So we need to make sure that there is minimal noise pollution or noise disturbance from the bedside. Okay, this is like a medical monitoring, and you need to watch the vital signs of the patient. Sometimes your patient will be more confused, not because of ICU psychosis. Let's say you have a patient with a respiratory problem. So what will happen? This patient may be hypoxia. This hypoxia can cause confusion to the patients. To avoid this one, what you have to make sure, you need to monitor the patient at the same time. Okay. The medical causes which is covering under pain, which may not be adequately controlled in ICU. Pain is considered as the what fifth vital signs. So you need to address the patient. So if the patient is an intubated also, you have to use appropriate pain assessment tool and monitor the patient and manage accordingly. Okay. Critical illness like pathophysiology of certain illness or trauma or stress on the body during the illness may aggravate or increase the intensity of the ICU psychosis or confusion. Medication, certain medication which can cause you confused. Okay. Especially those medication which is going to affect the CNS. So there is a wide variety of medications. So those medication when you are taking, it can cause again hallucination to the patient. That means you don't have a stimuli, but you feel that you are in heaven, or maybe as Sana mentioned, in hell as well. Okay. So we'll proceed to the next one. Infections creating fever, toxins, which can again worsen the situation. Metabolic disturbance like electrolyte, especially sodium, which is confusing. Okay, if the patient is having low sodium, you will see the patient become drowsy. If the patient is having too much sodium or hypernatremia, it can again cause confusion to the patient. So hypoxia, as I mentioned already, elevated liver enzymes, which can indirectly, what will happen? Patient nitrogenous body waste will be more, and patient can have coma like behavior. Okay. Heart failure, because of heart is not able to pump enough blood because of various reasons. Cumulative analgesic effect, already the patient is post-operative, and along with that one, for pain medication you are giving some medication, it will cause more confusion to the patient. Dehydration, these are the medical causes which can cause symptoms. What you will see, the patient will be extreme excitement. Okay. And anxiety, restlessness, hearing voices, that is auditory hallucination, clouding of consciousness. They will be able to recall something, but they will not be able to exactly recognize where are they, what is happening with them. Hallucinations, nightmares, okay, disorientation, agitation. Some patient will be really agitated, especially head injury patients. Delusions, abnormal behavior, fluctuating level of consciousness, which may be passive as well as sometimes may be aggressive, which you might have seen in many patients. So if you observe these kind of symptoms, especially immediately after stopping the sedation or extubation, this might be ICU psychosis. So these are the symptoms which you will observe from the patient. ICU psychosis is often vanished magically within 24 hours when the patient started sleeping normally or the patient become regaining consciousness. There will be some remnants will be still there, but it will go back. But if it is still persisting after 14 days of ICU admission, when the patient is fully out of sedation, still if the patient is having this problem, this is something need to be ruled out, maybe because of underlying pathology in the brain or maybe some neurological problem. Okay. Unfortunately, ICU psychosis usually resolves completely when the patient leaves the department. They will have some impact still. Okay. So what is our role? We need to help them in reorienting. What we can do, treatment of the psychosis clearly depends on the cause. As I mentioned, if it is environmental cause, we need to control the factor. If it is medical cause, we need to control that part. So the treatment is based on the cause. So as nurses, what is our responsibility? We need to identify the cause and treat accordingly. Okay. Ensure that patient is getting enough sleep. No environmental pollution, especially from the voice. Okay. Unwanted voice disturbances, and try to maintain the routine of the patient as much as possible. So when the family is coming, ask them to talk something related to the patient. Okay. Not about the patient disease condition, what's happening in outside home, something happy news. Try to reorient them. So those kind of things will make the patients more calm and assure that they will be okay after few hours or maybe days. Okay. So this will help them to make them more calm. How is ICU psychosis treated? As I mentioned before, if the patient is having dehydration, you need to rehydrate the patient. If this is because of the infection and toxins, you need to treat the infection. And sedations, sometimes patient might be having extreme sleep deprivation, which will, there are many studies which says that patient who has sleep disturbance or sleep deprivation, which will be high risk of developing ICU psychosis. So we need to make sure the patient is getting enough sleep. And if it is persistent, like it's go to a level of psychosis, what you have to do, you need to give antipsychotics. One of the example here mentioned is haloperidol. Okay. This one we covered, I think, already. What we have to do, primary goal is to correct the imbalance and restore the patient's routine, return to the patient's normal activity as quickly as possible, using more liberal visiting policy. Because once the patient feel that there is someone who he know is visiting and their sound, their stimulation, it will make them more calm. Okay, providing periods of sleep, protecting the patient from unnecessary excitement, minimizing the shift changes. And some hospital they are following like a routine that one nurse will take care, like three, you have most of you have three shift, right? This three shift you will
Yes.
be handling one patient.
Yes.
So
Yes.
this will make the patient more oriented than changing the face every day. Okay,
Mm.
nowadays we are all wearing masks, so even if you are the same person, patient will still get confused. So if you are, some hospital they are following, any of the hospital they are following the system. We don't have the
Yes.
system here. Where
KMC Mecca.
only KMC Makkah is here. What about other people? I'm not getting. Maybe they are sleeping, eating.
King Fahad and Jazan also.
King Fahd General Hospital or a military?
No, King Fahad in Jazan Hospital.
King Fahd also you are following the same system. You are taking care of the patient for 3 days, the same patient, right?
Yes, right.
Ah, okay, very good. Because this one will, as long as the patient is not that toxic, right? If the patient is too much toxic, and if you are giving saying the same person for 3 days, that will be very bad for the staff.
Yeah, we will bring sick leave.
Yeah. This is something different, but this will help the patient to get oriented with the system as well as with the people to whom they are taking care of. Reviewing the medical procedures, explaining the procedure, what's happening with the patient, asking the patient if there is any question or concern, talking with the family to obtain information regarding religious and cultural beliefs. Some patients they feel that if they pray, if they hear Quran or some according to their religion, that will make them more calm and they will get more there is a less chance of confusion. So depends on the religious behavior, you can help them in bringing. Some patients they are conscious and they are oriented. Maybe there is a therapy which is known as bibliotherapy, where you will give a favorite book for the patient can read. Sometimes some patient they need some books, some they wanted to have a music, some they want, depends on the patient's choice. So you can provide if there is an opportunity, or we can ask the relative to bring those kind of things. So it will help them to be more calm, and the chance of ICU psychosis or the already developed a mild psychosis can be prevented. Okay, this one already I discussed. Reviewing all medical procedure. Okay. Long time before, when I was a staff nurse, okay, in cardiac surgery ICU in 2007, what happened? We had a planned system. Most of our patient, like cabbage surgery, patient who's coming for cabbage surgery, what we follow is to avoid confusion, especially ICU psychosis. We have a system which is pre-operation education. So most of our patient, they will be admitted like 1 or 2 days. If it is a planned surgery, they will come to the department. There is one person nursing education for the patient. Okay, it's a patient educator. They will give them orientation. They will literally bring the patient to the ward, to the ICU, to the OR, and introduce the staff whom they are going to be operated and how they will be. They will let them to talk one extubated patient in cardiac surgery ICU. So this patient who's about to go for surgery will go to the ICU and talk with the patient who's recently extubated, and they will explain how the situation, how many tubings will be there, how they have their experience in the ICU. So this will make the patients more calm. Okay, this kind of education system in some hospital they are following as well. So this will make them more calm, as well as there is less chance of ICU psychosis. Okay. Anybody has any experience with ICU psychosis patients? As I mentioned before, do you have any questions?
No, all it's clear. Thank you.
There is one more part, not yet finished. For a while. Okay, by the way, before we proceed to the next topic, do you know what is sensory deprivation, which I have already covered? Any idea? Where is
No.
Abdurrahman? I don't see him. Abdurrahman, you are there? We'll catch you tomorrow, inshallah. Okay, this is a slide which was prepared by Miss Darjeeling Michelle, MSc Psychiatry from other hospital. We are just using her slide. You can see the slides or no?
No.
Not yet, right?
No.
Wait, I'll share. Okay, now you can see the slides.
Yeah.
Okay. Okay, this is about sensory deprivation. This one which we have covered. Sensory functions is altered and person's ability to relate to function within environmental changes and distractly. One of the reasons for sensory deprivation is the one which we discussed already. What is that? ICU psychosis. Okay. And if the patient is having continuous or persistent continuously sensory deprivation, it can lead to sensory deprivation. This is a definition which says absence of usual sensation from the way, especially accustomed visual, auditory, tactile, or both. It can lead to more problem to the patient. Okay, this is one of the definition, simple definition: sensory deprivation under stimulation. That means patient does not have any sensation or the sensation is blocked. Okay, imagine your head is covered with a cover and you don't have no way to get either vision or audition or tactile simulation or olfaction. Everything is closed. So this is a situation for a patient who is having sensory deprivation. Generally means lessening or not able to sense any of the usual stimulation. Got it? Okay, causes can be impaired ability to receive environmental stimuli, maybe because of the underlying disease condition, or inability to process the stimuli. They are able to sense the stimuli, but they are not able to give a feedback or able to respond to the stimuli. Okay, clinical manifestation: patient will be depression or withdrawal syndrome. Patient can have hallucination because there is no stimulation from external world. Delusion: they will see something but they will misinterpret that one. For example, simple example delusion, what you say is that you are seeing a piece of rope and misinterpreting that one as a snake. So this can be delusion. So what they will see something on your nurse's hand, let's say syringe in the patient nurse's hand, they will misinterpret this is something else, maybe flower. Okay, in that case it's nice, but actually it's not happening. Okay, disorientation or impaired memory, sleeplessness, fatigue, inability to think, and decrease the problem solving issue. When they are asking, when you, for example, we have a patient in ICU, when we ask them after the discharge where you are going to say, they will be thinking thinking for a while, and they will be not be able to give an answer. They will think that maybe I will go thinking like that. They have a thought block system. Okay, this is a kind of sensory deprivation. Visual problem can be eyeglasses with proper, patient is already using a high power lens and right now he don't use it because he don't have the chance to receive the visual stimulus, so it can lead to problem for the patient. Okay, for a second. Okay, we'll continue. You can see my slides.
Yes.
Ah,
We
okay.
can.
Okay. Only Fatima and Sana is there.
So me.
Okay. Sorry.
You
Who
got
else?
both of us.
Who else is there? I think the others are not there.
No, I'm here.
Me. I am here.
Who is here? Can you
Amal.
mention your
Ragad.
name?
Amal.
Amal.
No.
Okay. Amal, and who else?
Me,
Ragad.
Afaf.
Sorry.
Also me, Afaf.
Afaf is there. Okay, good.
Ragad also.
Ragat. Ragat as well. Thank you, Ragat. Okay, thank you, guys. We will continue. The eyeglasses with patient who have problem. So this is an issue. So we need to for a while. Okay. Okay. Adequate room lighting, which we have already covered during ICU psychosis, sunglasses or window shades. Usually when you are having a patient who's conscious, try to provide a room which has a window so that you will know what's happening outside. Okay. Otherwise they will not know what is happening. This will make you, because I'm sure among the healthcare workers, nurses are spending like 90% of your time with our patient. But still there is a 10% we are not spending, especially in our hospital. I don't know in other hospital. We have a room, each patient is in a separate room, so whenever there is a procedure or something need to be done, you will go inside, do the procedure, then we will come out, right? So the remaining time, the whole day, or maybe the whole month, maybe months, the patient is alone in the room. So if the patient is conscious, like GCS maybe 9 and 10, those kind of patients, if the patient is having a room which does not have a window or does not know outside communication, for sure you can expect to have a sensory deprivation or later problem, maybe delirium, isopsychosis. To avoid this one, make sure that the patient is given a room with a shade or a patient who has a window room. So this is what's happening in our ICU. If the patient is conscious oriented, we'll try to shift the patient to an empty room where there is a window, so that patient will know what's happening in the outside world. Okay. Clock with the large number so that patient will be able to know. If the patient is able to recall then the time, it will be easy for them, like that. Okay. Hearing aids, if the patient is having hearing problem, you can provide them hearing aids. If there is a problem with the battery or some issues, we can ask the relative or the hospital is providing, we can fix the issue so that the patient will be having a better hearing, so it will improve their sensation for hearing. Smell, fresh smell. The problem is that we will make sure that there is no bad smell happening in the room. We don't have an option to provide a fresh smell or maybe flowers. If the patient is admitted in the ward in our hospital pool, according to our hospital pool, it's okay to bring. But in ICU and critical care unit, we are not allowing to bring anything which is having fragrance. Maybe it can cause allergy, or according to the infection control guidelines, it is prohibited. Does any other hospital allow you to bring anything like flowers from outside in your hospital? Yes.
No,
Yes or no?
no, no,
No, no,
not
no.
allowed.
Which hospital? King Fahd?
Yes.
Okay. Yeah, same policy. We are following the same policy as well. So this is how we are. So what we can do is make sure that we are not asking you to clean, but we will make sure that the room is having not unpleasant smell, which will be very bad for the patient. Okay. So we'll make sure that this is happening. Okay. Taste, fresh food, seasoned, not overcooked. Okay. We have a limitation, especially in critical care unit. We have a limitation. If the patient is unconscious or maybe like fully sedated, no need to worry about all these kind of, because already the patient will be on continuous feeding. Okay. Once the patient started regaining, that's a situation where you will act upon how strategies to prevent, how to prevent ICU psychosis, as well as at the same time you will start with the strategy to prevent sensory deprivation. So regarding the taste, what we can do, you can discuss with the clinical dietitian which is coming at the bedside. You can tell them this patient prefers this kind of food, so they will see whether this food can be given according to the diagnosis of the patient. So if there is an option to choose another type of food within limitations, so we'll provide them. Okay, nurses, we have a great role in discussing this kind of things. I'm sure we are discussing, as well as this will help the patient to improve the sensation of taste. Or I do, in our hospital, we don't allow, or we don't, according to hospital policy, we don't encourage any food which from bringing from outside, especially in the critical care unit. And I think the same they are following in other hospital as well. So those kind of things, within our limitation, we can provide them what is possible. Touch, therapeutic touch, you know how to do therapeutic touch? Yes or no?
No.
No. Okay,
It's
you
not
have to.
all our touch is therapeutic.
Yeah. You have to do properly therapeutic touch for the patient. Usually there is a misconception. Some patient depends on the age of the patient. Usually if the patient is conscious oriented, there is one way that you have to keep the patient hand like this. You can see my hand or no?
Yes.
Yeah, okay. So this is a patient hand. So you have to hold the hand like this. Then you will be holding like this. Okay. So your patient and your other hand will be on the top of the patient. So with your both hand, the patient hand will be inside your hand. This will create a warm touch to the patient. Okay. So this is how you will touch the patient and ask them how they are feeling. Okay. This is really something comforting the patient. Okay, again it depends on the cultural practice, because in our religion it does not permit you to touch everyone. Okay, so you have to be careful with the age of the patient as well as the cultural background. So depends on that one, you will touch the patient, that will give you. Massaging depends on the patient need. Okay, some patients who has pain, some massaging, especially, have you heard about reflexology?
Yeah.
Okay, I think I
But we are
mentioned.
the one who need it, not the patient. He's sitting.
Nurses, of course, you need, but that will be after duty. But during the duty, what you have to focus is the pain. Some patient will be having severe pain, especially in the lower extremity. There is two benefit. One is patient will be relief from the pain. Second time, patient will have less chance of developing DVT, because our ICU patients or patients admitted in critical care unit, they are at high risk of developing DVT. So this can be prevented. Turning and repositioning depends on the hospital policy. You need to turn the reposition the patient every 2 hourly or according to your hospital protocol. Okay, hair brushing and grooming, this is you are routinely you are doing for the patient. Amount of pressure of individualized for the comfort of the patient, it depends on the hospital facility what we have in our hospital in KMC, here in KMC Jeddah. The bed is like air mattress, so you can patient can, there is an option in the bed, patient comfort. So if you press that one, you can go and choose, like for example you want to have more like soft effect on the head, and you can choose those options in the bed itself. Okay, clothing of various textures, which is not allowed in our hospital policy, we are providing the hospital gown. Okay, so make sure that you are giving at least a good patient gown, so this will help the patient. Okay, any doubts?
No, thank you.
No, thank you.
Okay. So now you know, you have a brief idea about sensory deprivation and ICU psychosis, right?
Yes.
Yes.
Do you want to have a break?
Yes.
Yes,
How long?
please.
How long?
5 minutes
As
enough.
much as you can give.
Right. Now it's 10:26 or maybe let's say what time we will see? 10:35?
Yes.
Okay. Don't leave, just mute it and you take your break.
Okay, thank you.
Welcome. ക്ലാസ് ഇപ്പൊ 2 കഴിഞ്ഞ കാരണം Okay, you guys hear her? Hello.
Yes.
Okay,
Yeah.
we will start. Okay, this is care of dying and death patient. This is the last topic from my side. I know the schedule, there is a change, and they will continue later. Okay. I'll finish my part and I will go. Then Miss Safa will join also. Hello. You can hear me?
Yes.
Okay, we'll continue. This is nursing care of dying patients. So this portion will be taking care of patient who is dying, because in critical care unit, as you know, always we are seeing patient who's
Sir, the slide it's not appear.
it's not appearing.
Yeah.
Wait. What about now?
Yes.
Yes.
You can see.
Yes, yes, we can.
Yes.
Okay. Let's continue. Nursing care of dying patients or death patient. Okay, depends on the cultural background. We need to take care of the patient. This is highly sensitive area where we need to take care. Okay, most of our patients in critical care, you are not sure that whether 100% the patient will recover from the current illness. So what's happening? You have to be careful, sensitive with the patient issue. Here comes the role of a critical care nurse. You will be most of the time acting many other roles, but the most important role for a critical care nurse who's working in an ICU or a critical care unit, especially with dying patient, is you will become a patient advocate. Okay, so how you can deal with this situation, and you have to be careful. Two things you have to be careful. One thing, you need to take care of the patients if the patient is conscious and it's like last stage of disease. Usually those patients will not be in ICU, they will be in palliative care. Okay, first thing, you need to make sure that patient has asked them, the relative or the patient himself, when he was conscious, do you have any preference? Okay, he might have something need to be done during death or after death. Okay, certain one is patient's determination. Okay, or the medical doctors, they will go for a decision, like let's say DNR, to put the status in patient DNR, how they are dealing with the DNR, and in what situation, what are the things need to be covered in DNR. One of the aspect in covered in DNR is, before the patient is put on DNR, they need to discuss with the family members and take decision regarding his will, for example, his properties, how it need to be done. We use the word advanced medical directives. This is a term which we use. So this is supposed to be discussed with the family as well as with the patients. Okay, if the patient is conscious. If the patient is not conscious, the one who is responsible for the patient. So this is highly sensitive area where you need to take care. Okay, life begins with the birth and ends with the death. Clients' death is often unpredictable. Patient failure on the part of health personnel. Nurses has a greater role in dealing with the patient who's dying or taking care of the dead patient. The definition in literal way, we can say medical nursing intervention defined as a promotion of physical. And one of the definition, if you remember, one of the definition of nursing is that helping the patient for a peaceful death. That is also a part of our job. So we have to be careful when you are choosing the intervention for the patient. So certain things need to be done. Meeting needs to be for a dying or dying patient. The things need to be addressed, assessing the need of the patient, what kind of needs they need. They need to have less pain. They need to provide a calm and quiet environment. You are sure that the patient will die, okay, in a few hours, few minutes, maybe in a few days. So we have a great role in assessing the need of the patient. Explain the client condition to the treatment. Who has the privilege? The doctor will explain the condition to the family members. I think this portion is already covered by Mamnisreen in crisis management. This is one of the crises which we are going to face it. So the family members will be involved and they will be explained about the condition and treatment modality. Maintain good communication with the patient. In communication, don't give false reassurance. Let's say, for example, the patient, you are sure that the patient will die in few hours or days. Don't tell them that patient will be okay. Okay, your okay will not be the okay for the patient. So some patients you have to explain at their level what is the level of understanding of the relative. You have to explain at their level and tell them that this is what you have to. Don't give any false reassurance. Okay, so make it clear. And if they have any doubts, ask them to clarify. Okay, if you are the one who's communicating with them. Anyway, according to our hospital policy, we are not the one, it is the doctors. But when you are a witness in communicating with the family, make sure that they understand, especially those patients who speaks different language, a multilinguistic patient. So they will be speaking a different language. If you are there, make sure that they understand what they are trying to say. Maybe the doctor is a different nationality and the patient is a Saudi patient or Arabic speak patient, and you are the translator. So it can happen in some situation, right? So there you have a greater role. Promoting self-care and self-esteem. So most of the time, whatever be the appearance of the patients before the illness, or we try to maintain most of the appearance. I don't know, you have the habit usually. uh, there is a part which we have to take. For example, patient is wearing a spectacles, okay, or maybe some processes when he was before the illness. So after the death, at least before the burial, sorry, for the burial, we need to make sure that this is still there, the specs or what, so that the patient, when the family look at him, they will not have a bad feeling. Okay, they will look exactly the same as before the illness. So this is one part of promoting the self-care and self-esteem. Allowing the family members to assist in care. For example, some patients I heard before, like Sana was asking, whether is it permittable for the family members to stay during code blue. It is permittable. Okay, in our hospital also there are certain situations during visiting hours, or there are certain situations where the family relative or one of the strong person, he wanted to stay inside the room and during the CPR. We, if they are willing, we are allowing them. Okay, only the weak person we are sending them outside. Sana, you are here?
Yes, sure.
Yeah. There are situations where we allow the patient relative also during the death inside the patient room. Okay. So there, meeting the client's needs, psychological, physiological, and spiritual needs of the patients. This also need to be addressed. Depends on the situations. Okay. This is the stages of dying. This is a standard format, like evidence-based practice. You have certain strategy, like Erickson's psychosocial tasks. So these are the level the patient as well as the family members is going through. They need to have the initial part will be denial, isolation, then they'll be angry, then they will bargain, depression, and acceptance, like level of acceptance.
No.
Okay, grief and stages of grieving, I think, which is already covered by Sanal is going to discuss about this portion in detail. Okay, this is a situation where you have to respond to the loss or the crisis which is happening to the patient. I'm going to discuss about this in detail. Okay, it will be appearing like facial appearance of the patient, whether the patient is having experiencing any pain, which you can get from the facial experience. Changes in the sight, speech, hearing, respiratory stats of the patient, circulatory system. You need to go by systematic or system-wise assessment, head to toe. Like we could say, the technical word is cephalocaudal assessment. You have to go from head to toe assessment, depend to know the needs of the patient as well as how to take care of it. Facial appearance, where usually you'll see this is during the stage of dying. Okay, facial muscle become relaxed, cheek become flaccid, moving in and out. Like you can see, we say this is gasping stage, right? So you can see this one even in the ventilator. You will see the patient is struggling, air hunger. You will see this stage. Then changes in the sight and speech, hearing. It will be blurred. Patient will not be able to get enough. There will be disturbance in sight of the patient, and they will not be able to speak properly. Respiratory system, you will see the respiratory become shallow, sometimes more deeper breathing. Circulatory system, you will see patient is going for this one, hypotension, like that, depends on the situation. Okay, pulse become very weak. GI system, you will see hiccups is very common, the patient who is like in the last stage, and there will be slight gag reflex, okay, which you can feel. Death rattling sound heard through the throat, like it's like a sound which you will see here, especially during the last stage of death. Then genital urination, usually sometimes the patient will have retention or bowel incontinence. You will see them passing the motion and urine during the last stage, because they are using the control of the sphincter, both the sphincters in the anal sphincter as well as urethral sphincter. Skin and musculoskeletal, most of the patient, have you noticed a person who's like old age, let's say 99-year-old person who become like bent, stupid
Yeah, yeah,
but during the death they become straight, right?
yeah.
All the muscle become relaxed. So this is a stage you are being attaining at the last stage of death. CNS, you will see patient is responding less to the pain, as well as they are not able to give you any feedback. Okay. Signs of clinical death, which is determined by the doctors usually. You will have an absence of pulse, heartbeat, and respiration. People becoming fixed and not reacting to light. Absence of all reflexes. Rigor mortis is after death. Okay. Stiffening. That's why immediately after that you have to be take care of the patient. You will make sure that the head is the mouth is closed, the eyelids are closed, because at one stage once you reach the rigor mortis you will not be able to do. Okay, that's why according to our religion we are holding the hand right over the left, and you are tying. So this is, if it will not be happening, it cannot be done later, because it will be difficult. Then postmortem hypostasis, this is a later stage. Goals of nursing care during hospice. We don't have hospice here, but if it is in the patient's hospice, improving the quality of life, especially for the terminal patient who has carcinoma, patient who has end stage disease like renal failure, those patients confirm death. But in critical care, most of the time it is not planned one, it is an unplanned one. Only those patients who has DNR, we will get a time to take care of the death. Okay. Our main strategy is palliation is one of the things which is mentioned here as a pain here. You see the pain here. The standard way is palliation. Palliation means alleviating the pain or suffering during death. This portion is mainly, and we discussing mainly about the ventilation of the patient. This is a determination by the doctor or the medical team. They will determine whether the ventilator can be withheld. According to our religion, withdrawing or disconnecting the ventilator, which is not allowed, right?
Yeah.
So we will continue the ventilator most of the time, doesn't matter. So the patient will slowly die. Okay, we don't disconnect the ventilator as such. But there are certain country in the world where they are allowing, we say mercy killing, euthanasia. Okay, that means slowly. The medical team make a decision that patient will not benefit from continuing the ventilator for a long time. So they will take a decision to disconnect the ventilator. Okay, there are many country in the world which is permitting this mercy killing. Okay. Then fatigue of the patient need to be addressed, and respiratory, which we cannot solve, but you will try to reduce the symptoms, okay, as much as possible. Then identify the priorities, the need of the patient, provide meaningful interaction with the family and family members, then facilitate peaceful death. Usually, according to our hospital policy, what we are following, that I will discuss in the coming slides. Okay, there are certain strategies. Depends on the patient's religious background. Okay, according to Islamic view, according to our hospital policy, what we follow is that the patient is, for sure it is they supposed to be turned towards qibla. Then you will provide, usually what we are following in ICU is that we will turn on the uh, two channels, Haramain channel, either Makkah or Medina, to play Quran loudly, to make the and make the most of the alarms slow at a mute mode, so that it will be calm for the patient, so it will be easy for the patient, as well as to, if the family members they wanted to accompany with them, it's okay, we'll let them to go inside and sit with the patient. But and if they have a different religious background, okay, it depends on the country where we are practicing, so they will allow the religious, each religion has their own way of practicing. Okay, they have their own way of dealing with the death patient, especially during last. For example, Christians, they will follow a different system like that. Okay, then this is a portion which we have already covered: pain management, ventilation, fatigue management, skin care, mouth care. This is during as well as after the death of the patient. Okay, pain you are giving usually pain medications, though the patient does not need like inotropes to maintain the BP. Usually pain medication we will not withhold to make the patients relieve from suffering. Okay, these are some of the aspects. Just if the patient is having dyspnea management, like these are the drugs which usually prefer to give for the patient to reduce, especially those patients who has too much secretions. To avoid, if it is too much, to control that, we give anticholinergic, especially atropine, to prevent the secretion, and some bronchodilators dilute, depends on the patient situation, you will give. Okay, This is a positioning, as I mentioned. You will give the position according to our religion. We will position the patient towards Qibla. But in ICU, it's not practically possible. But at least we'll try to make them a calm and quiet environment. Okay. Rights of the dying patient, which is very important. A person who's dying has the right to be treated as a person until death, as well as taking care of the body after. Then having pain to be controlled, cleanliness and comfort, maintain sense of hope. Then participate in his care or planning of respectful caring and medical nursing attention. Okay. I don't know in your when you are student in a nursing student in college, when we were student, what we have been taught is that at the end of, you are taking care of the body, right? Dead body care in the ICU or in the critical care. After packing the body, usually we say goodbye to the patient. Okay. This is our one of the requirement in the procedure. Here we say maybe salam to the patient. We'll pray for the patient for a while. Okay. This is a practice.
Okay.
Okay. Any doubts?
No, thank you.
Thank you.
Okay. That's it. Thank you so much. And we will continue with the other speaker.
Thank you, Anish.
I can start. So I can share my. Yeah. Okay. Okay. So he finished. Okay. Okay.
Screen share idu option ittund.
Start ചെയ്യാവോ? Sound clear ആണോ? Clear? Okay. Assalamu alaikum. Good morning all. So welcome. My name is Sanal Salim, MSc Cardiovascular. I'm working as educator in King Abdullah. So today we are going to discuss about loss and grief and what is the nurse's responsibility for this one. So first one, what is loss and what is the meaning of grief? So all of you know loss, all of us experience loss. Loss means we are losing something that is precious for us, like any object or any person, any nearby relatives, or any belief or any relations. So anything that is precious for us, if that one lost, that kind of feeling, that is loss. And it is universal for all of us, that kind of feeling. Then the coping mechanism, how you are adjusting to that one, that is called grief. It can vary from person to person. So I lost something. So the way I adjust to that one is different from the way you adjust. So it's different from person to person. That kind of psychological adjustment is known as grieving. So it's a process we will see. So loss is defined as an experience of parting with an object, person, belief, or relationship that you values. It's a universal process. Next one, grief. The grief means it is psychological. So how you are adjusting with, or what is your response for that lost thing? For example, there is a loss of job, or a loss of a significant person in your family, or any relationship. So how you are physiologically and psychologically adjust or response, what your response, that is called grief. So it is a characteristic pattern of psychological and physiological response a person experience after the loss of something. So this is known as grief. Grief. The main goal of grieving process is to healing the self. As we discussed before, if something happened in our life, all of us should go through certain process that we will learn later. Certain process that help us to adjust with that particular event and healing ourselves, and also for recovering from the loss. So this is a goal, our ultimate goal of grieving process. As a nurse, your role is to facilitate the patient or even the relative for the grieving process. All of you know there are a lot of grieving process. These are a few examples. Any diverse relationship breakup, health, even health condition, any sudden disease, loss of job, any financial problem, miscarriage, retirement, even death of pets, or any serious illness for our loved ones, even loss of friendship and safety. There are a lot of things. All of you, all of you experience some kind of loss. All of us. It's normal in life. So these all are the example of loss. So the thing is how you are responding to this one. Now we will see which all are the type of grief. So how each of us are responding to grief. As I told before, the way you are responding to your loss is different from me. My way of coping is different. So now we will see the common types, how the people responding. First one, anticipatory grief. You can call this one types. Anticipatory grief. No need to write the entire slide. Just we will think practically. Anticipatory grief means, for example, somebody is having a serious illness. For what's the example? Any last stage of cancer or anything. You know that that particular person is not going to survive. You know the reality that he will pass away. So you know what is going to happen. That is called anticipatory grief. You are preparing yourself for the situation. So this is the one least well-known type of grief. And you can feel the grief, that kind of feeling, before the actual loss happens. So this example I already told you. So terminal illness. This is an anticipatory grief. Next one, normal grief or common grief. This is normal in everyday life. So always we have some feeling of loss. So some people carry on with their normal routine. Even though I have some problem, today I have some loss, but I am moving on. It is not affecting my daily activity. I am sad inside, but I am moving on. So this is normal. So if somebody look at me from outside, I am perfectly all right. Nothing with me. But inside, I have pain. I have that kind of feeling, but I am not expressing to the public. So this is normal grief, normal process. I hope this one clear. If you have any doubt, you can unmute and ask her. Okay.
Okay.
Yes. Next one, complicated grief. This is Shaya problem. Why? Okay. I lost something. I cried a lot. After that, I am okay. After 1 to 2 days, I am okay. I accept the reality. I am okay. But what if I am crying for 1 week, 2 weeks, 3 weeks, 1 month, 2 months? What will happen? So then it will move in a different way. We need to look that one psychologically. It affects my mind. I am just simply sitting and crying. I'm not taking bath. I am not eating anything. Just so it will affect my daily life. So this is complicated. You need to view that one in psychological point of view. So that is complicated grief. Later we will learn how to adjust with this kind of things. Okay. Delayed grief. Delayed grief means something happened to me. I faced that one in a challenge. It's okay for me. It is not going to affect me. That is my immediate response. For example, what I lost my there is break in relationship or friendship. Simply friendship example. Okay. Oh, if she goes, okay, no problem. I have another one. This is my immediate response. I'm happy. But after 1 week, 2 weeks, what will happen? I'm again thinking about that person and I start crying. So this is delayed grief. You understand? Okay. So immediately, immediately. Thank you for your response. Immediately, I'm showing. It's just a show off that you are nothing to me. Go, go, go. After 1 week, I start rethink and I have problem. So this is delayed grief. From the name itself, it's clear. Inhibited grief. Something happened to me. What I am doing, for example, any death of near one or death of my pet or something, whatever. What I am doing, I'm not at all thinking about that. I engage in some other activities. I am showing others that I don't have time to think about that. I am more busy with something else. I'm putting my all energy to doing something else. So I keep myself distracted. So this is inhibited grief. Means I am suppressing that one in my mind. I'm not at all thinking about that. So this is inhibited grief. Disenfranchised grief. This means, okay, I lost my pet. I have a cat. Suddenly, I lost that one. Simple example. For you know that feeling because you are too much attached to that particular cat. But think as a third person who is looking at you from outside. Oh, just a cat. For that, she is crying for 1 week. Means that loss is important for you only. For an outsider or a third person, that is nothing. They cannot see any worth in that particular thing. But you know the feeling. That kind of feeling, grief is disenfranchised grief. Okay, for society, it's nothing. For you, it's more important. Absent grief. Next one. This is almost similar to inhibited grief. Means show a extreme version of inhibited. Inhibited we already discussed. Anybody can tell what is inhibited grief? Just for an interaction. Anyone? Inhibited, the name itself. We discuss. We suppress in our mind. Okay, that is absent grief. Last one is exaggerated grief. Similar to complicated grief, that is not improving on time. So usually we have a time limit for the grief. Okay, 2 days cry, like that. But it is going beyond that one. And it may goes to chronic depression. So that is exaggerated grief. Now, signs of depression. Ultimately, everything ends up in depression. You know what is depression. Not happy, simply not happy. Difficulty, alteration in daily functioning, like not interested to go for job, not focus on personal hygiene, thinking about death, and angry at all in family, no enjoyment. In extreme stage, hopelessness and suicidal tendency. So the main complication of grief is, if it is complicated grief, the patient can go for chronic depression, and that may progress for suicidal tendency. So that is a complication you need to focus. Always talking about suicide. These all are the warning signs of depression. Kubler-Ross model. Actually, these all are the stages we need to pass, all of us, including me. If something happened in my life, I need to go through this process. Then only I will be okay after some time. Something happened to me. What I will do first, as a human, all of us, denial. I am refusing that one. I am blindly refusing. Oh, it's not reality, it's not happened, like that. Simply denial. So that is first stage. Let's see. Initial stage to protect from anxiety. No, not me, it's impossible, it's not true, I'm just neglecting that one, I am just refusing that one. That is happening in denial. Next stage.
Anger.
Anger, good. Anger. I'm asking, why me? What I did to God? Why I deserve it? Why you do this to me? You know, this kind of feeling.
Yes.
So this is normal. So as a nurse, what you will do? Let them go through all these 5 stages. Then only they will be okay. If you are not allowing them to complete this stage, you are pushing the patient for depression or another psychotic conditions. Now next one, bargaining. Bargaining means, what's in the other term? You are challenging. Please give me until this time. I will do this. You are like a challenging, or you are arguing. That is bargaining. Then slowly you are going to accept. That is, you are going to depression. Slowly you acknowledge the reality. Then you will be depressed. Last one, acceptance. You accept everything. You accept the loss with the help of your family members, your supportive people, or as a nurse, you can help the patient. So this is a 5 stages of grieving process, or this is a 5 stage mainly you need to focus. This is important. Okay. Symptoms of grief: emotional response, shock, sadness, guilt, anger, fear. Physical symptom is important, especially that is sometimes patient can go to physical symptoms like tachycardia. You know, if you have something, you will be more anxious, or maybe panic attack. It is called medically, it is called a panic attack. So if you have panic attack or chronic severe depression, you have physical symptoms like dilated pupil, lower immunity. You are not eating, you are not drinking, that leads to weight loss. Fatigue, nausea, lower immunity. Then insomnia, agnes, and pain. So this is symptoms of grief. Keep in your mind, grief is not a disorder. So it is a process, it is a painful process. that can be long lasting, depends upon the person to person. As a nurse, what you can do? First one, be an active listener. Listen to them. Let them express the feeling. It can be different. My character, I'm talking too much, I'm taking long time. Okay, let me finish that one. Offer something, practically help them. Don't tell them big things. No. Whatever you can do, tell them, okay, I will do this one for you. Support after funeral, if suppose it is death, can be. There is no right or wrong way to grieve. Anything, people can express any kind of feeling. You need to acknowledge their feelings. Can be extreme emotions, you will witness. There is, although we defined 5 processes, it is not mandatory to stick Hello? Anyone, can you please respond? You can hear me?
Yeah.
Sorry, I think there is a power shutdown. That's why sudden. Yeah, so we'll continue. You can see the slides, huh?
Yeah. We'll see.
Okay, thank you. We are about to finish. Okay, so acknowledge the situation and let the bereaved talk about how they feel about the loved one. So let them express what is their relation, like that. Okay. Ask how your loved one feels. Accept your loved one feelings. Be genuine in your communication. Be willing to sit in silence and offer your support. These all are the general support things you can do. Now, something you need to keep in mind. While talking with this kind of those who are in extreme depression, don't say like you will be all right. You know yourself that nothing is going to be all right immediately, but don't give false assurance. So about saying you will be all right, you must be strong for you, your parents, children, like that. this too shall pass, and like at least you had times together. No, so try to avoid this kind of wordings. Instead you can say, I'm sorry for your loss, I can't imagine what you're feeling right now, but I'm here to help you. How can I help you? So, and you ask straight questions like, let me know what can I do for you at this time, like that. So this is your nursing responsibility in this case. Okay. So the main things we discussed today, the definition of loss and grief and various types of griefs, and the complication is pointing towards depression and suicidal tendency, and what is the stages: denial, anger, depression, bargaining, acceptance. That kind of 5 stages, and how as a nurse you can help the patient to cope up with the situation. These all are the main key points for today. So thank you all, thank you for your time. So any questions?
No, thank you.
No,
Okay,
thank you.
thank you so
you.
much. See you. Okay. Ma'am Nasreen. Ma'am Nasreen. So we'll call the next person. Hello. Hello, sir. I finished. I finished. What? I finished. Next person. Yeah. Next person can start. Okay. Bye. Hi, yes, just how I want to exit this one.
السلام عليكم ورحمة الله. بس من عندك.
وعليكم السلام ورحمة الله.
طيب حنرجع دحين للأستاذة صفاء، بس تدونا دقيقتين كده بالضبط عشان نفتح لها البرزنتيشن.
مفتوح يعني. السلام عليكم، سامعيني؟ الو.
ايوه
ايوه
ايوه معاكي.
ايوه سامعينه.
ايوه معك.
طيب كويس. باين البرزنتيشن؟
ايوه واضح.
واضح. طيب تمام. طيب my name is صفاء الهندي. Today we will talk about nursing care models and patient acuity. إن شاء الله يكون الموضوع يعني ما هو جديد عليكم. هو الموضوع احنا نبدأ نتكلم على السريع عشان الأجواء الحلوة. طيب today we will learn outcome, describe the concept of nursing care modules and list of the classic types of nursing care models, discuss each type of nursing care models, advantage and disadvantage, identify the nursing care models, explain nursing staffing by patient acuity. Our introduction will be the nursing care delivery models has been described as a structure approach for organization to provide nursing care client by values and beliefs, goals. This is the reference. The nursing care models on the system of nursing care delivery is of called care modality. This is another called of nursing care models, care modality. The care modality is defined a method of organization and delivers nursing care in order to achieve this desired patient outcome. The goals of success patient care delivery include high quality and low cost care. Why we are doing the nursing care models? We want high quality and low cost of care to achieve the patient outcome and satisfaction level is high. This is our types of classic nursing care models. The first one, total patient care. The second, functional. The third, team nursing for primary nursing. The first one, total patient care. What's meaning of total patient care? It's a case of method to organize nursing care in which nurses are responsible for total care of the patients, but only for hours in which a specific nurse is present. So during the shift of the duty of the nurse, she will give the total care to the one patient. Nurse is responsible for planning, organizing, and performing for the patient. Nurse carrying only one client assigned, oldest method of organizing patient care. The example of that, the unit they are using this total patient care is ICU or a post-anesthesial care unit. So the registered nurse for 12 hours, she will have the patient care for one patient, organize, perform all the care for the patients. So only one nurse for one patient. What is the advantage for this total patient care? High degree for autonomy, lines for responsibility and accountability are clear. The patient received holistic and fragmented care. The disadvantage, each registered nurse has a different approach to the care and not cost effective. The second type is functional nursing. Is division of according to a specific type. So one nurse, she will have a specific task for each shift and technical aseptic of the job. Staff members assigned to complete the specific tasks for the patients involved during World War as a result of nursing shortage. Unskilled worker trained perform routine simple tasks common used in operation room. This is the dividing. The head nurse, she will have a registered nurse for the medication treatment, and the others registered nurse, she will be assigned for the assessment. The others will be vital signs and hygiene, and the fourth one will be for the stocking and hygiene. So the staff during the shift, they will be specific task for one patient. What is the advantage? The care is provided economically and efficiently. Minimal number of registered nurse required. Tasks are completed quickly. What is the disadvantage? Yani, if you are the patient and you will have how many assigned nurse with you, you will be confused. So the patient will be confused with many care providers. Care may be fragmented, less oriented for individual and holistic client care, more oriented to task accomplishment. طيب. The third one is team nursing. It's delivery approach that provide care for group of clients, coordinating the team for registered nurse and aid under the supervision nurse called the team leader. So you will have team leader. Here, what is you will have the head nurse and you will have team leaders. The two team leaders will be have a group of nursing with the group of the patients. What is the advantage for this team nursing? High quality, comprehensive care with high proportion for the staff nurse. Team members participate in the decision making and contributing expertise. Oversights for novice nurses and temporary personnel can be. Disadvantage, continuity suffers if daily team assignment vary. Team leader must have a good leadership skills. Why? Because the team leader will be the responsible one. If you have good team leader, you will have good team. The last one type, primary nurse, is approach in which a nurse has responsibility and accountability for continuous of care since the patient will be admitted until discharge. The registered nurse, primary nurse, assumes 24 hours responsibility, planning, directing, and evaluating care. What is the difference between the total patient care and primary nurse? The primary nurse, she will continue with the patients every day, every day. And if she have 12 hours, she will the handle one, she will continue the next day, the same patients. What is the example for that? Like the long stay or home health, hospice. What is the advantage or disadvantage? This is the category. Primary nurse, 24 hours responsibility for planning, directing, evaluating patient care. Associated nurses provide care when primary nurse is off duty. This is the second nurse. Physician and the other members of the healthcare team also involving. What is the advantage? High quality, holistic patient care because you will be assigned 24 hours for the patients. Established report with the patient. Registered nurse feels challenged and rewarded. What is the disadvantage? Primary nurse must be able to practice with high degree of response autonomy and accepted 24 hours responsibility. More registered needs needed, not cost effectively. طيب, this is the fourth types. What is the where will be applicable? Like we say, total patient care in ICU, functional nurse in operating room, delivery room, team nurse in patient and outpatient area, primary nurse in home health and long-term patients. Then the second topic we will talk about nursing staffing by the acuity patients. What is the definition patient acuity level? It defines categorized of the patient's accountability and assessment of his or her current condition. So you will see the condition of the patients. You will put your staffing according to the acuity of the patients. The nursing staffing process determined providing acceptable number of nursing personnel provide desired level of care met the patient demands. How you will do the patient acuity by nursing staffing? When you will do the nursing staffing, 2 hours before the end of the shift, nurses will be complete the acuity form. Any additional admission prior to start next shift must be considered in staff assignment. The head nurse and charge nurse on each shift will review after every day or every shift, filled up the patient acuity form. The head nurse, charge nurse will ensure equal and fair distribution of the nurses. The equal distribution of patient assignment submit the acuity level patient and divide with the number of nurses in duty. So how you will do the nursing staffing before 2 hours of the ending of the shift? You will see the condition of the patient, and according to condition of the patient, you will divide your nursing staffing. For all the department, they are using this except the ER. You will follow the triage and acuity scales. According, we have this Canadian triaging, and you will do the acuity of the patient, then staff nursing. Thank you. Any question?
No, thank you.
No, thank you.
Thank you.
Right. Thank you, Mustafa, for your valuable presentation. So, do you have any question so far? يعني ما عندنا اليوم غير سناء هي اللي بتشارك. الله يعطيك العافية سناء، يعطيكم العافية كلكم. بس خلاص كده احنا خلصنا السيشن. So thank you very much for your attending. And إن شاء الله see you next week. Next week عندنا academic day, right?
إن شاء الله.
إن شاء الله بإذن الله بإذن الله. حيكون مع الملك فهد ولا القوات المسلحة؟
والله I'm not sure, we will
القوات
see.
المسلحة إن شاء الله بإذن الله. Anyway إحنا اللي حنفتح لكم بإذن الله اللينك، برضو حيكون نفس اللينك هذا حيفتح. تمام؟ thank you very much and you can leave now. Thank you so much. بالنسبة للملك عبد الله، المتدربين الملك عبد الله ممكن يكونوا معايا شوية، الباقيين يقدروا يخرجوا. سناء وعبد الرحمن وفاطمة ايوه فاطمة
رغد.
رغد. صح. طيب معانا دحين سناء وعبد الرحمن ورغد. فاطمة موجودة؟ مين سارة وتوم؟
توم فاطمة بس
أيوة أنا
سارة.
موجودة
أيوة
فاطمة.
أوكي خلاص، بس سارة يصير عشان نبدأ الميتنج حقنا. طب حابين انكم تاخذوا الميتنج دحين، نعمل الميتنج دحين عشان هي كلمتين كلها ورضغطاها، ولا تبغوا بعدين؟
لا عادي ناخذ.
لا
لا
أفضل
دحين.
دحين خلاص. طيب ممكن اشوفكم لو سمحتوا ولا ما ينفع؟
يو
لا مرة ما ينفع.
طيب بس خليكم معايا. طيب بس انا ابغى يعني اسمعكم.
تمام.
معك.
الان دحين حنتناقشوا جدا مهم بخصوص الفورماتيف اسسمنت. طيب حاعمل لكم بس شير سكرين. formative assessment. طيب إن شاء الله بس يفتح، لأنه مو راضي يطلع لي. شير سكرين. أيوة طيب كده شايفين؟
ايوه
طيب تمام شايفين PDF اللي
ايوه
معروضة. طيب نبدأ. بسم الله الرحمن الرحيم. الميتنج حقنا، بس أنيش ما دخل معانا صح؟
لا لسه.
بس دقايق أتصل عليه. طيب إلى الآن كيف التريننج معاكم so far؟
والله not very good to be honest يعني.
طيب قولوا لي إيش اللي لازم يعني نحاول نصلح. ما عندكم مشكلة؟
أيوة السكيدول مرة سيئة يعني. أمس كان عندنا نايت شيفت واليوم إحنا academic.
طيب
and we try to communicate with the head assistant. No action taken.
طيب
يعني we ask them to rearrange. We cannot come in academic day.
اوكي تفضلي حبيبتي. قلتي لي السكجول.
ايوه
طيب
أتوقع المشكلة عندنا كلنا، يعني في أكثر من يوم بالسكجول، نكون يوم السبت نايت شفت ويوم الأحد أكاديميك داي على طول.
طيب بالنسبة للسكجول بس هو المشكلة هذه مع الأكاديميك داي.
أيوة
بلس إنه إحنا ما إحنا عارفين المفروض كم يكون الديوتي حقنا يعني لحد الآن.
ما زبط
الروتا اللي
أيوة.
فاتت كانت 13 ديوتي، مع الأكاديميك داي كانت 14، وهذه الروتا 12 ديوتي غير الأكاديميك داي، يعني التوتال 16.
لا عدلوها صارت 11 ديوتي ومعاها 4، صارت 15 ديوتي كلها.
ايه 15 ديوتي.
نحسب لكم الساعات، يعني أنا حروح مع بولس نحسب لكم الساعات. إذا
هذا
اللي هو عندكم نايت شيفت وبعدين
يوم السبت
أكاديميك داي.
أيوة كمان مس نسرين في النايت شيفت، يعني إيش حنعمل؟
إلى الآن
ما حنقدر نذاكر ولا نقدر فولو أب ولا شيء.
طيب خلينا نبدأ من الفكرة الأساسية. خلينا دحين أنا أخذ الكونسيرن حقكم وبعدين نبدأ نتكلم في بالنسبة كيف تذاكروا وكيف طيب تاني شيء انتوا عندكم ايش قلتوا لي اللي هو الديوتي اورز؟
ايوه
صح، ما انتوا عارفين.
في شيء كمان يعني هم ملخبطين بيننا احنا كدبلومة وبين الناس اللي جايين كروس تريننج، وبين الناس اللي السي بي بي مدري السي سي بي حاجة زي كذا. فبتجي التشارج نيرس فعليا يعني بدون أسلوب بتتكلم معانا، بس عموما معايا صارت معايا أنا بتتكلم بأسلوب مو حلو، بتيجي تقول لي أنت جاية تشتغلي ما أنت جاية تقعدي. يعني مثلا أنا مع بريسبتور،
ايوه
أول كان في الروتا عندي 2 بريسبتور، دحين عندي 1 بريسبتور، فبجلس معاها فعليا طول ما أنا في أيام الديوتي أنا معاها. حتى إذا كانت مثلا هي ماخذة CL أو AL أو تايم باك، بروح للتشارج نيرس وبقول لها إنه أنا مع فلانة الفلانية هذه ما جات اليوم، فحطيني مع أحد تاني، بجي من نفسي.
ايوه
فونس ما بتكون معايا البريسبتور، لكن بتكون هي admission 1 ولا 2 ولا وات ايفر، بتيجي تقول لي لا أحطك مع فلانة أنت حقتك admission.
كيف يعني؟
يعني مثلا أنا البريسبتور حقي في آخر يوم دوام
حقتك ما جات مثلا،
إذا ما جات أنا من نفسي أروح أقول لها حطيني مع واحدة تانية.
طيب حلو،
عرفت من نفسي.
ثاني
لكن آخر يوم ديوتي كنت
أيوة.
البريسبتور حقي كانت موجودة لكن admission. عرفتي؟
كيف يعني admission؟
يعني ما يكون عندها patient.
ايوه
فحطينا الفيرست ادميشن بحيث انه لو جاء البيشنت هي الفيرست ادميشن. فدخلت علي التشارج نيرس بتقول لي انت ليه جالسه هنا، انا بدور عليك. قلت لها البريسبتور حقي ما عندها بيشنت الان في ادميشن. قامت قالت انت جايه تشتغلي ما انت جايه تجلسي، وحطتني مع واحده بس عشان اكفن معاها.
طيب هذه
يعني
هذه نقطة تانية، التشارج نيرس ما هم عارفين هم انتوا دبلومة وما انتوا محسوبين معاهم في الخط في
ايوه يعني في
مين
مس
هذه التشارج نيرس
اندرستاندينج.
اللي تعطيني اسمها؟ انا ما حقول اسماء لكن انا
اسمها
لازم
ديفيا.
اعرف. ديفيا.
شوفي مس نسرين، يمكن عشان انا ستاف كنت فاوريدي انا لما يجي احد يقول لي ساعدي سوي اعمل بعمل من نفسي. خصوصا انا خلاص عارفه البوليسي والبروسيجر فبشتغل من نفسي. يعني حتى امانه البريسبتور معايا ما هي تعبانه معايا لان انا عارفه السيستم وعارفه كل شيء.
طيب
فما بتتعب معايا. لكن اذا مثلا البريسبتور حقي ما يكون عندها بيشنت تحطوني مع احد تاني، وونس ما يجيها ادميشن ولا يجيها بيشنت خلاص خلصت من هذه روحي عند هذه، ماني جايه انا يجلسوا يلعبوا فيا رايحه جايه رايحه جايه. اسلوبها كان جدا سيء امانه.
هي معانا كلنا كده مس ديفا.
طيب انا ححاول ارتب اجتماع مع رئيس القسم خلال الميتنج حقهم حق الديبارتمنت عشان يعني نوضح دي النقاط والامور هذه عموما الستاف والتشارج نيرس. طيب إن شاء الله بإذن الله هذه النقطة لازم نوضحها. بس طبعا ضروري أنتوا تكونوا عارفين إنه فعلا إحنا حتى لو أنتوا متدربين فأتجنبوا إنكم مثلا تجلسوا على الجوالات، مثلا نجلس فاضيين أو نجلس في اللونش روم فترة طويلة. أنا عارفة إنه هذه التصرفات ما بتصدر منكم إلى الآن، أنا ما جاتني شكوى إلى الآن يعني إنه أنتوا مثلا ما شاء الله تبارك الله، بالعكس يعني بيمدحوكم بيمدحوا في شغلكم وبتساعدوا كثير بتحاولوا تتعلموا ما شاء الله تبارك الله. إلى الآن يعني ما جاني أي شكوى. بس بالنسبة إنه تشارج نيرس ضروري يفهموا إنه أنت حتكوني حتى لو في عندك ستاف البريسبتور حقتك ماسكة أدميشن، المفترض إنك أنت تكوني معاها assigned.
أصلا الأدميشن we have to prepare for.
فانتوا طبعا انت لازم تكوني assigned معاها حتى لو عندها admission لانه انت حتكوني معاها في الادميشن.
ايه هو ده.
however هذه يعني حنتكلم معاها، حكلم بولسن واكلم ان شاء الله انيش بخصوص
good ma'am, Nisreen, I joined already here. Excuse for a while. If we have those things which you are discussing, if it is related to our trainees, I think if we have participants from other hospital, they can leave, right? They can leave the platform.
Okay. And now we don't have any participant from other hospitals, sir. Now we are discussing about the trainee concerns. So they have concern about the schedule because yesterday they were night. How many night shift was yesterday?
أنا وفاطمة.
So
أنا وسناء.
And today is the academic day, and I told Paulson to give them at least a day off before.
Yeah, it was The day Sana, she informed me, it was informed to, actually we were holding that one for Sibahi. Then once the day on Sibahi, last Sunday itself, it was informed to Sahar. She said she will do the adjustment of the duty, but it was not done, right?
Yeah, I sent to her message and I sent to Brother Bolson. He said, no, communicate with Sahar, she is the responsible. But no one of them sent me even okay. So actually, if they tell us that we have a bad communication, like what happened before, I already communicate, but there is no response for anybody.
problem inshallah. Next week we'll not.
Let me check also, because according before, like a few days before, I asked her, she said no one communicated with her. I will check her number also.
No, we send message to her والله.
Type. We'll see.
Regarding this, it's better to communicate with Sahar and Anish as well. Yani, let Anish know about it.
Okay.
Please.
Wallahi, I communicate like even HR. I will communicate next time. I don't know. But I'm not under HR. This is the problem.
Okay. But regarding duty hours, sir, just check with Paulson and Sahar how many hours they have, because they're supposed to have 40 hours per week.
Yeah, we had a calculation last time when Abdul Rahman, he raised a concern regarding they have 3 duties per week, 12 hours duty. When we calculated the hours, we consider the academic not as 8 hours. What we have discussion is that we will see the according to schedule how many hours is scheduled. For example, 2 days, let's say 4 hours only the academic day. So the remaining hours is supposed to be for the duty hours, right? So total
Now the academic hours, just keep it 8 hours. I will discuss this one with you later.
Yeah, because this was the concern. I think during last meeting also, this was our concern. They raised the issue, so we asked them to consider exactly the hours which we are discussing, not 8 hours. So they calculated the academic hours exactly according to the schedule. For example, if it is 4 hours only, they reduce only 4 hours. That's how they have more duty.
No problem. And regarding this, the staff, there the CN and also some staff, they are not. They cannot differentiate between diploma and the program, the CCN program.
16. 16.
No, not 16. 23.
Next. 23. Yes. We have a course that day.
Course?
Trauma course, actually, 23 and 24.
Last Wednesday.
2 days. 23 and 24.
Sir Anish.
For a while, ma'am. For a while.
Trauma course was postponed.
No. For a while. Dr. Mahdi is here. He's asking something.
طيب نرجع تاني معلش، نخلي أنيش شوية على جنب. حاكلمه بخصوص الميس كوميونيكيشن اللي بيصير مع السي ان، فهذه ان شاء الله النقطة برضو حنوضحها معاه. خلاص طيب. any other concern قبل ما نبدأ الفورماتيف اسسمنت؟
آخر شيء متى المفروض احنا حنمسك patient ولا يعني بس observe ولا؟
دحين انتوا خلصتوا الجنرال اورينتيشن؟ خلصتوا كلكم؟
ايوه خلصنا.
طيب جميل، عشان نسوي لكم شهادات. فحاشوف السيستم عندي اذا كان اوكي خلاص كلكم مخلصين ويصير ايش اعمل لكم شهادات. هذا الشيء. الشيء الثاني الكومبتنسي، الجنرال كومبتنسي. طبعا مو رغد خليك كده في حته يعني. عبد الرحمن ومين، فاطمه وسناء.
ايوه
بداتوا الجنرال كومبتنسي مع أنيش؟
بدأنا بعض
كلها، خلصنا بعضها بس.
طيب جميل. ما حتخلصوا هذا، احنا نسأل لكم دحين كم اسبوعين
تقريبا خلصنا 2 أو 3 إلى 4.
Try to speak in English.
اداكم البلان. الله يسعدك.
أنيش.
اوكي سر أنيش.
Now Thank you, ma'am.
discuss regarding
competency
for the general competency, if started or not.
Okay.
So just to ensure to complete the general competency for them, but طبعا for طيب for the formative assessment احنا خلينا نركز على البروجرام حقنا. طيب شايفين السكرين؟
ايوه
طيب باينه عندكم الكومبتنسي صح؟
ايوه
عندنا الفيرست مانث اللي هو نوفمبر. ايش الكومبتنسي اللي المفروض تخلصوها؟ cardiac monitor set up and lead placement, intravenous therapy, dose and flow rate calculation, intravenous therapy insertion, discontinuation, administration, set change, and care fluid pressure infusers. I think هذه ثلاثة competency مختلفة صح؟
yeah.
medication administration, parenteral routes, والblood and blood product administration, والblood fluid pressure infusers. هذه 2 competency، يعني تقريبا المجموع أكثر من 5 صح؟ طيب هذه إن شاء الله by end of this November عشان نبدأ نرفع التقييمات.
أستاذ نسرين هذه تتعبى الكومبتنسي باي هو يعني البريسبتور ولا أنيش؟
البريسبتور and أنيش. البريسبتور يعمل لكم وأنيش يوقع معاه. ماشي؟
أوكي.
and you will follow up. Sir Anish?
Yes, ma'am. Yes, ma'am. I'm hearing.
Okay. طيب. This is regarding competencies. طيب, what other tasks that you have?
We should prepare the file.
طيب, الفايل كتبت لكم هي صح؟
Yeah.
طيب أستاذ نسرين بالنسبة للفايل فيها اللي أنت أرسلتيها كم منها اللهم صل على النبي حق الإيفاد صورة من الإيفاد لازم
أيوه الله يسعدكم.
بس ممكن عارف أنا لأنه نسيته في تبوك فكلمت أهلي يجيبوه يمكن ما حيجي إلا على
مو لازم يجيبوه. لا مو لازم يجيبوه
أو يصوروه
هو صورة ويرسلوه يعني بلاش حرام مشاوير وكده يصوروا لك سكان وأنت تطبع لي هي. أنا أحتاج صورة بس.
طيب شيري ولا يهمك.
أنت الأصل معك
أي كلها موجودة بس إنه نسيها في تبوك كلها وراي.
والسعودي كونسل طبعا تحطوا لي هو BLS حاولوا تاخذوا خلال هذه الشهرين. ماشي؟
كلنا عندنا غالبا.
ايوه.
طيب بالنسبة للكويزز طبعا عندنا كويز آخر بعد ما نخلص الأكاديميك داي حيكون يوم خميس. تمام؟ طيب إيش عندنا كمان؟ عندنا هاف أكاديميك داي أكتيفيتي اللي هو 1 day per week. اللي المفروض إيش يكون فيه زي الريفليكشن. طيب هذه إحنا ما بدأناها بس خلاص إن شاء الله الحمد لله خلصنا من سباهي. فحنبدأ نعمل لكم الويكلي ريفليكشن. تمام بإذن الله تعالى بس طبعا كلهم على حسب الديوتي حقه. طيب في سبيشال أسايمنت المفروض تعملوها total of 8 assignment per year. فتبدأوا من دحين تختاروا إيش الأسايمنت اللي ممكن تعملوها. بس
اللي هي الكيس ستدي.
لا الكيس ستدي شيء ثاني. الكيس ستدي برزنتيشن اورال هذا واحد بس. طيب 1 per year. طيب بس الاساينمنت ممكن يكون كيس ستدي. ممكن انا اطلب منكم ريسيرش تعملوه. ممكن نطلب منكم تعملوا برزنتيشن على حاجه معينه. تمام. فهذا الشيء انتوا تختاروا. يعني انا ما ابغى اعمل لكم هي كتاسك انا احددها. لا انتوا حاليا تعتبروا ماجستير. طيب فهذه كلها تعتبر سيلف ستدي. الافضل انكم ايش تعملوا. انا احب الكيس ستدي عموما. الكيس ستدي هي اللي تتعلموا منها اكثر لانه من الكيس ستدي حترجعوا تشوفوا اخر مثلا ريسيرش اتعملت على كيس معينه. اخر ريسيرش اتعملت على بروسيجر معينه وتبداوا تطلعوا عليها. تمام. الكيس ستدي انا افضلها بصراحه. طبعا هذا كله يعتمد عليكم انتم. حتختاروا لي ايش ال8 الاساينمنت اللي تبغوا تعملوها خلال السنه. ماشي. فاول اساينمنت احنا نخلي هذا الشهر اكسكلودد لانه انتوا اوريدي يعني بادئين. فاحنا هذا الشهر خلاص about to finish صح؟ حنبدا ممكن من الشهر الجاي الاساينمنت
في ديسمبر يعني ان شاء الله.
ايوه ديسمبر. تمام. فحبدا استقبل منكم الاساينمنت ديسمبر. بس هو نوفمبر خليني بس اتاكد إذا كان نوفمبر لازم نعمل سبميت لأسايمنت ولا لا. بس إذا حابين إنكم تعملوا أسايمنت بسيطة خلال ده يعني تتكلم عن الإثكس، تتكلم عن الجريفنج ولا الكرايسيس ولا البيرن أوت، أو تتكلم عن الستافينج في خلال هذا الشهر، اتس اوكي.
تتضمن المواضيع اللي أخذناها ضمن المحاضرات.
ممكن تختار شيء ثاني، ممكن شفت كيس انترست كيس تبغى تعمل لها كيس برزنتيشن، تبغى تعمل لها كيس ستدي،
حلو،
تمام،
يكون أفضل.
يا فهذا يعتمد عليك انت، على حسب قراءاتك، على حسب انت الانترست، انك تعمل مثلا شفت كيس كانت very interest so you can do presentation، ممكن تعمل ورقة عمل، ممكن تعمل case study، it's okay it depends on you. لكن الكيس study presentation اللي هو for 1 year هذه حتكون يعني ما هي زي الاساينمنت اللي ممكن تعمله. يعني الاساينمنت ممكن تعمل 1000 كلمة، ممكن تقل أو تكتر، لكن الكيس ستدي يتهيألي حتكون أكتر من 1000 كلمة، 1500 كلمة. تمام؟
Yes.
طيب نيجي عند الكومبتنسي. الكومبتنسي 40 كومبتنسي، حتسووا مينيمم، طبعا مينيمم 5 كومبتنسي في الشهر. طبعا كل شهر مقسمة عندكم زي ما انتم شايفين كومبتنسيز، واحنا حنرسل لكم الكومبتنسي. يعني الافضل ما اعرف، الافضل انكم تطبعوها وتخلوها عندكم. طبعا
ايوه افضل
تخلصوا وتوقعوها، تحتفظوا فيها في الملف، يعني تجيبوا لنا هي نحطها في ملفكم. تمام؟
اوكي.
طيب انا طبعا ما حوصيكم، انتوا ادلت كلنا مسؤولين. الكومبتنسي يعني تكون يعني مرتبة وشكلها نظيف، الورق يكون مرتب ونظيف لما تيجي تسلموني، والله يعطيكم العافية. تمام؟
إن شاء الله.
هذه كلها documented لما يجوا الاكريديتيشن عشان يعني يشوفوا الأوراق، حيطلعوا على ملفاتكم. تمام؟
إن شاء الله.
طيب نرجع تاني للأسايمنت. طيب إذا زي ما قلنا كويز، بعد كل موديول في كويز. After each module you have a quiz. You have academic day activity, so it will be weekly. There will be reflection. There is an 8 assignment per year, so you can choose. طيب نحدد تايم فريم بس للأسايمنت. متى يعني ممكن تسلموا، يعني نخلي تايم فريم كده محددة كل شهر، متى ممكن تسلموني هي؟ يعني أو مثلا تحبوا تسلموني هو ثالث أسبوع من الشهر، يعني مثلا
يفضل على ثالث أسبوع.
ثالث أسبوع يعني تقريبا
عليهم 18-20 كذا في الشهر، من كل شهر يعني
20.
ايوه ايش رايك؟ ما ادري على البنات ايش رايك؟
ايوه so
ايوه عادي.
specify date for to submit the assignment. Sir Anish, what do you think?
Hello. Hello.
Yes.
Yes, ma'am Nisreen.
Sir Anish, we are talking about assignment submission. طيب, so we'll specify day
for submitting this.
To submit, yes. So I prefer to submit on the third week. Can be third week.
Third week of each month.
Of each month, yes. Third week of each month, Sunday.
Okay.
You can submit it through نقدر نقول you can submit by email better. So submit
by email.
ايوه to Mr. Anish. خلاص. to Mr. Anish by email. بعدين حنحدد يوم للبرزنتيشن، فنحدد يوم البرزنتيشن انتوا تعملوا سبميت للاساينمنت، ونعمل البرزنتيشن. طبعا عشان انتوا تعملوا بريزنت للبرزنتيشن حقكم حيكون يعني بريزنت للاساينمنت حقكم حيكون في نفس الاسبوع الخميس.
ايوه
ولا حسب الديوتي. لا هو المفترض انكم تكونوا كلكم مع بعض عشان تستفيدوا. هي الفكرة الاستفادة اكثر من اننا انتوا تعملوا سبميت وكل واحد مو داري عن معلومات اللي جنب الثاني.
الديوتي تبعنا كلها تختلف.
كيف؟
ليه ما نخليه by Zoom like this so we can discuss together?
Yes, can be by Zoom, so it's better.
بس you will count it as duty. لأنه لو عندي أنا 16 يوم وكمان في يوم راح أعرض وفي يوم راح أنا متى أشوف نفسي يا ماما متى؟
نحسب لكم هو ما يهمكم لا تخافوا على الديوتي حقكم والأيام حقتكم ما حتطير شيء.
والله ما عاد صرت أشوف إلا فاطمة وأنيش كان نفسي أني بس
ما يهمكم. شوفوا أنا في النهاية حتى لو كان في ساعات جيتوها إكسترا إحنا حنعوضكم كتايم باك. تمام.
باي ماني ولا تايم باك؟
ماني. لا حبيبي
money I am okay with it. Let's make it 20 days.
مين هيعوضك؟
لا حداكي ماني يديني أنا كمان.
إن شاء الله.
طيب طيب بالنسبة للسكيلز إيش حيكون في السكيلز عندنا برضو كيس بيست ديسكشن أو كيس بيست أسايمنت. طيب حيكون every month، يعني غير الأسايمنت حيكون في كيس بيست ديسكشن. تمام.
كيف راح يكون طريقته؟
طريقته برضو هو شوف الكيس بيست معناته أنت تاخذ كيس. يعني الاسايمنت ممكن يكون ريسيرش جبته تبغى تعمل له ديسكاس وذ اس، يعني كان لاتست ريسيرش في شيء معين، مثلا كان خلال دي السنه مثلا ريسيرش طلعت جديده، فهذه ممكن تعمل لها ايش ديسكاس لايش. لا هذا الاسايمنت. لكن الكيس بيست should be custody يكون من القسم عندنا. طيب
يعني بناخذ حاله ندرس نفس البيشنت من A to Z.
ايوه زي البيشنت انه احنا اخذناه كذا.
طيب في عندي كرايتيريا معينه طبعا للكيس بيست برزنتيشن ححط لكم هي بس عشان بس يكون عندكم فكره. الكيس بيست برزنتيشن انا ممكن اعمل انفيتيشن لكونسلتنت، يعني مثلا تديني الكيس برزنتيشن حقك، طيب الكيس ستدي، وانا اعمل انفيتيشن لمثلا اذا كانت الكيس نيورو تروما اشوف ايش مثلا دكتور تروما او نيورو يحضر معانا، بحيث انه مو يقيم
يعلمنا الاخطاء. ايوه يعلمنا الاخطاء،
يعني
يوجهنا
فور امبروفمنت، يوجهنا.
يوجهنا.
ايوه. فما حيكون التقييم، لانه التقييم حيكون احنا اللي نقيم وعندنا كريتيريا معينه نقيم عليها، لكن هو حيكون كموجه. تمام. طيب بالنسبة لللوك بوك، في لوك بوك طبعا الأورال برزنتيشن والأسايمنت هذا كله له شو اسمه فورمات تعبوها نعبيها يعني. فحوريكم هي كلها إن شاء الله بإذن الله. أرسل لكم هي بس تكون متوفرة عندي، بس تتوفر عندي يرسلوا لي
هي اللوك بوك
برنامج.
هي اللوك بوك اللي بتكون يعني كأسايمنت علينا.
في لوك بوك I think إنه اللوك بوك حرسل لكم هو حرسل كل
حسب مثلا إنه هو اللوك بوك اللي مطلوب هو نفسه الأسايمنت بيكون مطلوب منك 8 أتوقع منه في السنة أو حاجة.
في 15 لوك بوك لازم تسلموا في السنة.
15؟
ايوه
كل شهر واثنين.
كل شهرين. استنى at least 15 log books should be submitted per year. 2 log book every month. 2 log book every month. طيب انا حرسل لكم اللوك بوك كله، حرسل لكم هو حتى التقييم حق الاسايمنت حقكم حرسل لكم هو عشان تمشوا عليه. طيب طيب طبعا اللوك بوك هذا يعتبر سيلف اسسمنت. الاورال احنا نعمل لكم اسسمنت، الكومبتنسي احنا نعمل لكم اسسمنت، الاسايمنت احنا نعمل، لكن اللوك بوك انتوا بتعملوا نفسكم اسسمنت، هو سيلف اسسمنت. تمام. طيب الايتر برضو افري مانث. الايتر حيكون عن طريق ما اعرف ارسلوا لكم اكسس لل 145؟
لا لسه
لا ما عندنا،
لانه اتوقع انه في اكسس لل 145 لكم لكم حساب في ال 145، فحنشوف هتابع مع المساعدة مع التخصصات. طيب هذا الايتر بالنسبه للايتر حيكون observation برضو كل شهر حنسوي لكم، هو احنا اللي حنسويه وحنبعته عن طريق ال 145. طيب طيب اي سؤال؟
لا شكرا.
طيب عشان نخلص الميتنج، طيب بس عشان مم. في أحد عنده أي سؤال؟
Ma'am Nisreen.
Yes.
Ma'am, regarding their ETMAM, ERP and
Yes,
the
خلاص
leave.
I send request
Okay.
to them all.
The
I think
the leave.
رغد you have صح رغد you have إتمام صح؟
لا مو قفلوا لي إياه لما عملت
لكم؟
الكليرنس. أيوة قفلوا لي إياه.
بس ما بنته عندي في شو اسمه يبغالي أطلب يضيفوكي أو إنه أيوة يبغالي أطلب يضيفوكي لأنه ما بنتي عندي في الERP.
الاي ار بي حقي من اول موجود بس از ستاف.
as a staff.
ايوه زي ما قالت لنا استاذ سراء.
طيب
الاي ار بي.
وما عندك اكسس للاي سي يو ستيل؟
لا عندي اخذت.
ما انت طالع عندك؟
تقصد الاكسس تبع ايش؟
تمام.
لا ما عندي
أيوة
انا كل هم
هو
الاكسس دور. انا
الاكسس دور ما حيدوكم غير الاي سي يو.
ده خلاص انا عندي بس
الباقيين. طيب عبد الرحمن عندك؟
لا ما عندي.
ما عندك؟
لا ما عندنا. اتوقع بس رغد.
Leave, ma'am, leave. Regarding the leave, how to apply their leave? It's supposed to be through the paper form?
لا. Yes. Regarding leave,
And
paper form, Sir Anish will show you paper form. But we will apply your leaves in the 145. So it will not be with the ERB. خلاص؟
Yes.
ايوه مو عن طريق لا موارد ولا الاي ار بي ولا ماي مانجر. دحين انتوا تحت التخصصات الصحيه سواء الليف حقكم تحت.
I think in the last discussion when we had, except your annual leave, the vacation, all the other days you need to compensate. So let us know your vacation when you are planning to take, as well as when you are taking ahead of time. Like not unplanned one, and if you have any days which is coming late, some because of some personal issue, something like that, you have to inform us ahead of time. So it will be, because it will be counted every month when we send the evaluation. There is one portion for absenteeism, punctuality, regarding the performance of each presentation, things like components of evaluation. So this will be monthly, will be sent to the Saudi Council.
Yes, exactly as Sir Anish said. Even sick leave, you have to pay for it. Yani if you have one sick leave this month, you have to come for duty in your off.
Sick leave?
So you
for
have
sick
to pay
leave?
back. Yeah, for sick leave you have to pay back.
And it's better to do in the same month compensation if possible.
طيب it is a sick leave. Yani I'm leaving in my sick because I'm sick.
But this is the situation.
But
If I get more, I will be more sick leave next month. How could this be?
The Saudi counseling.
Yes.
للأسف يعني. طيب any other concern? طيب just to sum up this meeting, we discussed first about the competency that you have more than 5 competencies to do this month and submit when it will be the submit for this month. بعد كده حيكون ال 4th week صح؟ ولا الكومبتنسي تبغون آخر أسبوع؟ last week.
ايش هو الكومبتنسي؟ الكومبتنسي غالبا حاليا زي ما شفنا هي اغلبها اشياء بيزك يعني وحنا عارفينها، فما حتاخذ وقت.
يعني برضو خليها مع الاساينمنت السبمشن مع الاساينمنت ثيرد ويك.
تمام ثيرد
يعني
ويك تمام.
خلي السبمشن كله ثيرد ويك.
ايوه
يوم الأحد. لا خليها اجل يوم الربوع عشان بس
ايوه ما تكون في نفس اليوم كلها،
يعني نخليه يوم
بس انها تكون على اخر اسبوع يعني.
ايوه ثالث اسبوع من كل شهر، يعني اكتب ثالث اسبوع من كل شهر يوم الاربعاء. طيب
تمام.
يعني مثلا في ديسمبر حيكون ثالث اسبوع يوم الاربعاء يوم 22 ديسمبر. طيب طبعا حتعملوا سبميت لايش؟ للكومبتنسي صح. ايش كمان؟
الكومبتنسي والاساينمنت.
ايوه
اللوك بوك كمان.
ايوه اللوك بوك.
طيب خلاص اوكي تمام. هو بس اللوك بوك عشان نشوف
شوف
متى
هو
حيجي عشان
اللوك
نبدا
بوك
نشتغل.
ما حيكون في ديسمبر الا برضه في ديسمبر، لانه مكتوب تو لوج افري مانث، فحيكون برضه في المفروض انكم تعملوا لنا لوك بوك في نوفمبر.
هو ما ادري هيمدينا ولا ما ادري والله.
هو اللوك بوك سيلف اسسمنت عارف، فانا حشوف كيف وحرسل لكم هو. تمام
تمام.
طيب من دحين افكروا في الاساينمنت اللي هتعملوه، ولا كل شهر تسلموني التوبيك قبل ما يبدأ الشهر؟ لأنه انتوا
ممكن كده
قبل
أفضل.
ما تبدأوا الاساينمنت ابغاكم تحطوا لي التوبيك، يعني كل واحد يعمل لي plan for the assignment، ويعمل لي plan for the case study، ويعمل لي plan for the CPE اللي هو الكيس based discussion.
الكيس برزنتيشن عندنا 1 بير صح؟ يعني مو
الكيس برزنتيشن هذا 1 بير يير، فهذه عادي ممكن بعدين تدوني هي، بعدين تعطوني التوبيك، يعني اخليكم كده تفكروا فيها كويس.
حاليا يعني عندنا بس اللوك بوك وال شو اسمه ده اللهم صل على محمد الاساينمنت.
عندك دحين اساينمنت طيب،
وكيس ستادي
وكيس بيس ديسكشن، 3 اشياء.
طيب الاساينمنت ممكن يكون كيس ستادي صح؟
كيس بيس ممكن،
يعني كيس ستادي ولا برزنتيشن، الشيء اللي انا ابيه بالاساينمنت.
بس الكيس بيس كيس بيس هذه لازم تكون كيس.
كيس يعني
الاساينمنت ممكن يكون كيس ستدي، ممكن يكون ريسيرش، ممكن يكون وات ايفر يو لايك تو ديسكس، لكن الكيس بيس لازم كيس،
لازم تكون كيس. اوكي يعني كيس من نفس الاي سي يو عندنا او الهوسبيتال.
ايوه هو الافضل انه يكون كيس وانت مسكتيها عشان تكوني عارفه كل شيء عنها، عارفه يعني حتعطوني فل كيس. طبعا الكيس مش بس انك تتكلمي عن الكيس وايش عملتوا لها من اسسمنت، ايش الكير بلان كان، كمان تطلعوا عليها ايش الريسيرش اللي مثلا تتكلم عن بروسيجر معينه اتعملت للبيشنت، او مثلا عن دواء معين اتعطى للبيشنت يكون مثلا دواء جديد او حاجه زي كده، يعني فاهمه؟
ايوه طيب الكيس بيس يعني راح يكون عندنا نقاط نمشي عليها انه، ولا انا اسويها
أيوة
كامله يعني، ولا في نقاط انه انا راح امشي عليها؟
ايوه في نقاط تمشي عليها.
تمام
راح نرسل لكم هي ان شاء الله. فان شاء الله يوم الخميس ابغاكم تعطوني ايش الاساينمنت اللي تبغوا تعملوه، ايش الكيس بيست اللي تبي تعملوها خلال هذا الشهر. تمام هذه الاثنين خلاص يوم الخميس ينفع؟
ان شاء الله ان شاء الله.
طيب.
ان شاء الله.
الله يعطيكم العافيه، وبرضه حرجع اذكركم.
معلش عندي بس استفسار صغير بس.
تفضل
استاذ نسرين. بالنسبه للاساينمنت ممكن مثلا اعمل كدراج ستادي مثلا،
اي اساينمنت اي ستدي ممكن تعملها، اي شيء تشرح اي حاجه.
تمام. في لها فورمات محدده او انه بكتبها عادي بعملها انا واكتبها
الاساينمنت خليني اشوف ايش الفورمات المحدده اللي ممكن تكون موجوده. انا اللي اعرفه
تمام.
في الكيس بيس برزنتيشن، والبرزنتيشن لها كيس برضو شو اسمه فورمات، بس الاساينمنت خليني اشوف لك. اتوقع انه كل شيء له فورمات معينه، فحرسل لكم كل الفورمات باذن الله تعالى. تمام لا
تمام. يعطيك العافيه.
الله يعافيكم.
خلصنا كده؟
خلاص خلصنا تمام. في عندكم اي سؤال سير انيش؟ do you have any concern to discuss?
No ma'am, thank you so much.
Thank you so much everybody.
يعطيكم العافيه.
يوم جميل ان شاء الله الله يعطيكم العافية. مع
يعافيك الله.
يعطيك ألف عافية. مشكور.